Hello, good morning, and welcome to Newsfile. This is your most authoritative news analysis platform. And here on Newsfile, as you know, we put Ghana first. On the show this morning, when did Ghana peak on the coronavirus infections as far as the numbers in Ghana are concerned? Is it that we are misunderstanding the aspects and government? These are some of the questions we are asking as Ghana surpasses 4,000 in the infection numbers. Again, Dr. Bawumia and President John Dramani Mahama have been having a banter. It is about who is best qualified to deal with your economy in crisis situations. Is it President Akufo-Addo and Vice President Dr. Bawumia together in managing the economy, or the NDC's regime? Has Ghana also been massaging the economic figures, macroeconomic figures, both at home and to the IMF? We'll ask these vexed matters, deal with them in a while. Stay with us. I'm Samson Ladi Anyenini. You're welcome back. This is your most authoritative news analysis platform, Newsfile. And here is my take, and I title it, Your Mask Wearing Protocol. Your Mask Wearing Protocol. Here are 10 things you must take note of because you need to wear a mask. Before putting on a mask, clean your hands with alcohol-based hand rub or soap and water. Number 2, cover your mouth and nose with mask and make sure there are no gaps between your face and the mask. 3, avoid touching the mask while using it. It's a temptation many of us can't avoid. You must try. If you do, clean your hands with alcohol-based hand rub or soap and water if you must touch it. Number 4, replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. 5, remove the mask, and this is how to remove it. Remove it from behind. Do not touch the front of the mask. Discard immediately in a closed bin. Closed bin. Clean your hands with alcohol-based hand rub or soap and water. 6, if you are healthy, you only need to wear a mask if you are taking care of a person with COVID-19. That was thought to be the best thing to do. But now, as you know, the instruction says that if you are walking out, if you are leaving your home, wear it. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it. Number 10, never share a mask. Never share a mask. And that's my take. Thank you very much. Now let's get to start our discussion. And we have a number of people, experts, who will assist us to look at the issues that we have to deal for you today. Now, here in the studio, I have Prosper Bunny, who is chairman, the NDC's technical COVID-19 team. Good morning, and thank you for joining us, sir.
Good morning.
Great.
Happy to be here.
We also have here Kweku Kwarteng, his MP of Boise West and Deputy Minister of Finance. Thanks for making time, sir.
Thank you, too.
Right. On Zoom, we have Dr. John Amwesi, his lecturer, Global Health Department, School of Public Health, KNUST, and leader Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine, KCCR. Thank you, Dr. John Amwesi, for making time once again. Okay. On Zoom also is Nana Kofi Kwache, Research Fellow, Doctoral Candidate, and Adjunct Assistant Professor at New York University School of Global Public Health Studies. He studies health systems, health services, and health economics with a special focus on provider payment mechanisms and equity in access to care. Thank you very much for joining us, Kofi.
Thank you, Samson. Great to be here.
Good to have you. All right. So, shall we begin? And gentlemen, particularly those of you who are the experts, and I'm talking about Kofi and John, by the time we are done, we will need you to educate us on your mask wearing protocol. When do we wear the mask? When do we not need it, maybe, and how do we wear it? How do you do it yourself, and why do you do it the way you do it? So that we can help a lot more people to follow the protocols. Now, as you know, if you go to the Ghana Health Service website, something happened yesterday and took our numbers, infection numbers, dramatically high up to 4,012. 4,012. Ghana's total count of confirmed COVID-19 cases from the 12th of March to 17th May 2020 to 7th May 2020 stands at 4,012. A total of 18 deaths have been recorded for the same period. In addition, there have been a total of 323 recoveries. Ghana's cases under care, that is active cases, as of 7th May 2020 stands at 3,671. Between the last update on the 4th of May 2020 and the current update, a total of 921 additional cases have been recorded. Over 50% of these cases were as a result of an outbreak in an industrial facility with 1,300 workers, of which 533 have been confirmed positive. Over the same period, 20 more recoveries have been reported. Bono region has recorded a case, and thus 13 out of 16 regions have reported cases. Currently, the only regions with no confirmed cases of COVID-19 are the Savannah, Bono East, and Ahafo regions. Right. So let's get to the focus. Let me start with Mr. Prosper Bani. From where you sit, as the team that has been put together by your party, what do you say about Ghana's management of COVID-19 pandemic so far?
Thank you very much, and I'm happy to be here this morning to discuss this topical issue of how we are managing COVID-19 in Ghana. I would like to stay up front that we can do better. The management of this pandemic in Ghana can be structured better, can be managed better, can be can transmit information to the population better, and can mobilize the citizens to become more conscious and be more receptive to some of the directives that the leadership has put in place. I'm saying this because since the first two cases on the 12th of March, there has been a lot of actions and directives from government. First of all, the closure of the border was delayed, which opened up space for a lot more people who had been infected from other jurisdictions to come into Ghana. Obviously, we all are aware about the processes that took place, the quarantines, the testing, and subsequently the contact tracing. At that point, all managers of crisis of this nature will have begun to project the manner in which these cases will increase. We didn't see any of those projections. But some experts even at that point could tell us that we will be having very sharp increases if the right measures were not taken. Indeed, government decided after 2 weeks to put in place a lockdown. Lockdown accompanied with certain measures, i.e. Restrictions on gathering, not more than 25. We also had the protocols of washing of hands, no touching of face. Churches were asked to suspend their activities. We went through, indeed, Easter without the Christian population celebrating the death and resurrection of Christ. Today, we have the Muslims going through their Islamic fasting and processes, and we also have their day of celebration after the fasting. We are still under a process of managing this COVID-19. As we speak, from the 12th of March to today, you could see the rate of increase of the numbers as we go along. Initially, the epicenter was only restricted to Accra and Kumasi and Tema and Kaswa environs. Today, it has gone up to the northern sector of this country, it's gone to the Volta region, to the Oti region, and those numbers are having significant increases. This is because something is not going right. And the message that is coming out from leadership is that there is full control on the cases in Ghana. This, I think, is not entirely correct. And there are several concerns also about the way the numbers are being churned out to the population. Most people who are critical observers of this process have doubts on the cases that are being announced. Citizens must have trust in the managers of this pandemic. That is the number one criteria for success in any crisis condition. Indeed, I've had time to comment and made my point very clear that we need to elevate the management of this process from a task force committee approach to a crisis management approach with a clear command structure as in other jurisdictions. This crisis is going to be with us for the long haul. Indeed, the last broadcast of the president, he was noted for the first time to have described the situation as a warlike situation. A warlike situation needs a warlike response. There is no two ways about it. Granted that we don't have the military in any battle with anybody, but the pandemic, if you consider it as an enemy force, you need to design a structure, a strategy, you need to design a plan, you need to put together capacities, you need to identify your frontline workers, you need to define all these all these categories of persons, institutions, and facilities that will confront the pandemic. As we speak today, if you ask where is the plan, where is the strategy for executing this fight against COVID-19, we are yet to see any document. There cannot be any consistent, strategic, tactical approach to address this if you do not have a plan or a strategy. Secondly, on this one, on the management of the cases, we also need to have a clear definition of the crisis management team. It cannot be a fluid team. People can go in and out, but we need to have a clear structure. We need to know who is in charge. That when we hear that voice, either early in the morning or early in the evening, we know we are getting the correct and accurate figures. We know we are getting the correct analysis of the data. We know we are getting the correct impact on COVID-19, on our people, the economy, social life, and how it's disrupting our cultural settings. We need to know the response approach. These are not normal times, and therefore we cannot have normal responses. Indeed, any approach, in fact, I've just touched my face mask, which is not proper. Indeed, any approach in addressing the economy cannot be addressed as though we are in normal times. I've had time to comment on how we need to have a targeted, a critical economic response approach to abnormal situation in this our country. We cannot have a copycat approach to economic recovery or economic development, as the case may be, or the management of some financial figures as a way of responding to this crisis. We need to have a transparent, accurate data and all the inflows in terms of resources coming into this country to respond to the crisis. We need to have some transparency in how this is managed. This is a crisis management situation. We cannot go on without transparency, timely, accurate information to the citizens to make sure that the citizens follow.
Is it your background with the United Nations in dealing with, as it were, peace-building development that you are talking about, a war sort of approach, or it is the science and the data as we have become, familiar with using, that you are basing the statements that you make here on? For example, I think a very critical point you make is that we can do better. Then you proceed to say there is no plan. Is it really the case that there is no plan? or that you have not looked to see that there is plan. And you have not heard the president consistently refer to the strategy, the plan, as it were. On the basis of Ghana's plan, the United Nations, the World Health Organization, has put Ghana 6th among countries that are effective in COVID-19 management. What do you say about that?
Well, let me correct you about my background. My background is not limited to conflict issues and peace building at all. My last management position in the United Nations, I was the director for Africa for crisis prevention and recovery. Crisis prevention means all manner of crises: drought, floods, health, earthquakes, every crisis that was expected, including pandemic.
Is it possible for Ghana not to have a plan, not to have a strategy, and yet to have the World Health Organization score it such high marks globally for being 6th among the countries that have effective means of checking coronavirus or managing it?
Well, my question to you and your viewers is, have you seen the plan? Have you seen the strategy? In every jurisdiction,
there is enhanced testing that has been going on. There is the increase in the laboratories that have been doing the testing. The president continues with the refrain that we will also test and do a lot of the tests to ensure that we are containing this. You don't see that's the strategy?
In every jurisdiction, and any response plan or a strategy can be assessed. You have to touch it, you have to read it, and comment on it if necessary. If in a global meeting, which I've participated in severally, you present what you are doing at a meeting, very impressive, the meeting could immediately score you very high. It's done. Whether we are making sure that people wearing masks today are complying to the wearing of masks, it's another issue. Regularly, as I observe these protocols and observe others are trying to adhere to the protocol, it is very disheartening that our citizens do not appreciate or understand, or not conscious of what the protocols means. Yesterday, about 80% of persons are met wearing the mask, had the mask below their mouth. And I had the opportunity to ask a couple of people. They say, oh, they cannot breathe. They don't understand what's going on. That when they get into the shop, they'll put it across their mouth. Is that the
same as not having a plan and not having a strategy? Well, if you do not have a plan, I doubt that from the very first onset, when the outbreak, the WHO announced and declared coronavirus as a pandemic, we issued, through the health minister, issued EI 61, also affirming and declaring it as such to begin our preparedness. Then we had an EI 62, we had EI 63, we have had 64, now we are around EI 68 or so. Now, for almost all the 8 EIs, don't you see a certain graduated, deliberate strategy and plan, including border closures and extension of the closures, the measures that were announced through EI 64 and the 67, also going ahead to, as it were, continue with the extension. And we're expecting that tomorrow, if the president addresses the nation, we'll be told about a next EI that may come out. Don't you see a certain strategy that is unfolding? The stimulus packages, everything that has happened so far.
I don't see it. What I'm asking for is the plan.
You don't see what?
I don't see where's the plan. Did you bring a copy of the plan?
I'll come to you.
If you brought a copy of the plan, I'm happy to say it and to acknowledge that there's a plan. We have asked for a plan. If you want to collaborate with government, we'll have to collaborate with government based on a plan that the government is following, and then we can collaborate with the government. But if there's no plan and every week you pronounce directives, and every week the directive changes based on what you are observing or experiencing, that for me, with my long experience in managing programs, cannot be a plan. We can have a day, the government knows what a plan is. If they don't have one now, because of certain reasons, let us agree on that. But if you say you have a plan based on weekly directives, I'm afraid from where I'm coming from, I cannot hold it and say this is a plan or this is a strategy. I am happy to work based on the weekly directives.
So the team that you work with as the NDC's COVID-19 team, I've seen very respected people, including medical doctors, you know, with some really very, you know, good background on the team. What have you been discussing and what have you been proposing as, you know, additions or alternatives for government to beef up what it does?
I'm sure you are aware, and I'm sure the media is aware, that we had put together 2 documents on what we think the government should do as complementing government's efforts. 2 very clear when we submitted to government. And unfortunately, we've not received any formal response, but we are happy that they have it. The former president, His Excellency John Dramani Mahama, has made some recommendations and suggestions as well, including the concerns about the water, rent, and electricity, and also advocating for certain protocols to be adhered to strictly in terms of washing of hands, proper wearing of masks, and all that. These are the president's addresses was recommendations based on his observations. Ours were 2 documents that we sent. We are not government, so we can't have a plan. We can only have documents to supplement or to guide government. But I just want to make sure.
Catch your breath.
No. Let me make sure on this plan and strategy. What I'm asking for, it doesn't mean that they are not giving directives for citizens to adhere to.
We are dealing with it. We are dealing with 3 T's as a strategy. You haven't heard the president repeat it over and again. You just want it on paper.
I have heard the president repeated it over and over again, as you said, quoting you. But I'm asking, where is the reference?
What does he repeat? 3 T's. What does he say they are?
They are. I think it says testing.
It's tracing, testing, and treatment.
Yes. Those things, fine. But where is it in any document? Let us get the definition of those 3 T's, and let's read something. We have given them something to read.
Thank you. Catch your breath for me. And Kweku, so this is how far we have come. And all of a sudden, we were told that we had peaked. And people are waking up this morning and yesterday in the evening up to this point, feeling very disgusted, not knowing whether to trust the management process, that you say we had peaked when we had what number, and all of a sudden we have 4,012 on our hands. The suggestion was that we had peaked and we were to decline. We'll get the experts to deal with that. But how could, we have gotten it so wrong? That's if my understanding of we had peaked and declining is correct.
Well, we did not get, to begin with, good morning to viewers, and good morning to you and my friend here. To start with, we did not get it wrong, and I will take some time later to explain what Dr. Bedusa Kodie, I'm sure that's the one you're referring to, what he said. But if you provide me the opportunity, I'd like to just make some brief comments to some of the issues that were raised. We can do better. That was his response, which I thought was a dignified response to the question you asked. And we agree. As a government, we can always do better. And it is a reason we're always having internal discussions, engagement with the experts to see how we can continually improve the way we are handling this pandemic. So we don't disagree with you on that. And when you said that, I got the impression that, yes, you're doing well, but you can do better. But what followed was, in my opinion, not really helpful. But, Sammy, maybe this kind of question you don't put to politicians. Because if you put it to politicians, we are going to get the kind of response that we're getting. I think you can go out there and ask the experts and ask people. I have heard many people say the government handling of this pandemic has been very good. And they scored the president high marks. We have seen the assessment by the World Health Organization. There are many experts across the world.
I'm trying to actually be double sure about that, because I'm getting, some information that suggests that that particular, rating may not be exactly the way it has been reported. But you go ahead.
That is
by the World Health Organization.
Yeah, that's my understanding, that we have handled it well. We have all seen that. So, as I was making the point, if you ask a politician who interprets any credit to government in an election year may lead to some advantages for government electorally, we are definitely not going to discuss the crisis we have. People are thinking about electoral advantage. That is how I see some of the points that have been made. Look, if you want to see the strategy of government, you need to look at the various instruments that have been issued, the various communications that have come from the president, and then in addition to the measures that have been deployed, the tracing, testing, in fact, isolating and testing has led government strategy in this area. And as the president has said again and again, we are relying on data and on science. That is what is leading government's approach to fighting this. And I think if you would look at what I've suggested to you, you'll be left in no doubt that government strategy for dealing with this is clear. I think it's clear to a lot of the population. I don't know, maybe you want all the instruments to be assembled. You want videos of the president's communication to us to be assembled and everything put together and presented as a strategy. It can be done. But don't give the impression that somehow we have been acting in some ad hoc way and that there's no strategy. I think it's a wrong view to take. But what I would say to my colleague is that it's very difficult to wake a person that is pretending to be asleep. It's very difficult to wake them up. If people look at what government is doing and they are minded to be uncomfortable because of what they consider to be electoral advantage, it's going to be very hard to convince them. I can rally all the things that I mentioned and give it to you as a strategy. You will still have ways to doubt that. So it is not something that I think we should worry our heads over. Before I quickly go to deal with the peak point made by Dr. Bedu Sarkodie.
You may deal with that briefly because we want the experts to focus their attention on that.
You also spoke about economic strategy. Maybe this is not a place for it. We may have time, so we all discuss exactly how government is dealing with the economy alongside ensuring that this does not get out of hand.
But look at things this way. Last week I asked Dr. Abuaji on the show, and he admitted the kind of, lack of proactiveness, if you like, that has accompanied some of the protocols that are rolled out. Before the lockdown was lifted, why could the management team not agree on making mask wearing compulsory, roll out the plan as to the specific, if it is legislative or whatever it has to be, before the president would do the announcement? The president did the announcement, and it took a week before advocacy repeatedly got the Ghana Health Service to issue a statement telling people how to wear a mask and making it compulsory.
Well,
we are being told by the same Ghana Health Service again that it is now, how many weeks after the president said that wearing a mask is central after the lockdown is lifted, that it is now that barbers, dressmakers or people owning saloons and the markets are going to be taught how correctly they ought to use a mask.
Samson, even before the president lifted the lockdown, I heard many statements and communication from the experts and from the Ministry of Health and Ghana Health Service advising us to be using these masks. And in fact, advising against fake masks being produced. And let's not give the impression that it was after the president's statement that we started discussing masks. But I do appreciate the point you make, that indeed, perhaps if it was a law that was required, we could have done something like that before the president issued a statement. But if you remember, when the president issued his statement, he did say that the Ministry of Health will come out with the necessary, because some of these things would require some engagement.
The president spoke on Sunday. It was only on Saturday, from that Sunday, only by Saturday, that the Ghana Health Service issued the directives regarding mask wearing.
I am not in a position to explain why that delay happened. We may want to speak to the Ghana Health Service to understand why we had that delay. But the point I am making is that even that 1 week gap, or the period before the president came out with the lifting of the lockdown, mask wearing was already being advised by government.
No, the government had not. The government had not begun to talk about the mask wearing. It took the president to commence that process and to bring that effectiveness. It was after the president announced it that it became the biggest issue to discuss.
Yes, I agree with you. After the president announced it, it became the big issue. And perhaps it is good the president announced it. But there's no way you're going to say that until the president announced the lockdown, nobody had heard any advice from any government official that we should wear these nose masks.
Government had not, no government official or government had issued any directive or any statement asking Ghanaians to wear masks.
Well, we can go on with this disagreement. I think viewers would check that for themselves. I saw many people wearing masks in town, even before the lockdown was lifted. I saw, when I was traveling to my constituency after Parliament went on recess, there were people wearing masks, there were police people wearing masks. I don't know how that happened, but I'm just making the point that it is wrong to assume that mask wearing started after the president's statement, and that before that, some arrangement should have been made, whether legislation or should have been made before. I'm saying that the Ministry of Health could answer why it took the 1 week. I don't have immediate answer. But let us not give the impression by that the wearing of masks was delayed or that some irreparable harm has been done. I just want to say that going forward, we should act more quickly and more responsively.
Let me just put it to you.
No, wait. No, please wait.
So the summary. I think the Ministry of Health has now come out with the guidelines. The important thing is that we continue to drum home these guidelines to encourage people to get the right masks, to encourage people to use these masks. Government is putting out as many of these as we can, and maybe we should take that and move instead of looking back and suggesting.
So after the president made the announcement, because there was the delay in bringing out the measures and actually making it compulsory, even the police, there were reports all over that they had a difficulty enforcing it. As we speak, of course, there is a directive making it compulsory, but there are no criminal sanctions, and I'm not saying everything must come with criminal sanctions. There are no criminal sanctions with it. You don't know how exactly they can enforce them properly. But tie into the question of maybe lack of proactivity because he has some concerns and he may have raised them in a certain manner, but you must admit that at certain times, certain things may have been done in ways that could have been done a lot more better.
I have already conceded that the people working in the Ghana Health Service and the Ministry of Health, they are human beings. So we cannot say that they are perfect. But you must look at the overall approach and responsiveness and see whether they deserve commendation or we should criticize them, people sacrificing so we can all fight this disease. Whether our attitude to them should be commendation or our attitude to them should be just chastisement.
The shambolic nature of the feeding program, giving out food packages and the rest of it, which actually threatened, you know, and provided sort of a fertile ground to create fertile ground for the spread. You would, so from what he's saying, certain things may not have been done well.
Look, I don't know how many times.
And maybe you don't have a script that you are looking to implement what you are doing. That's why this is happening.
Look, if you make a decision that there is a lockdown and people are hurt economically, so you want immediately to support those people, and you're going to distribute food, and the population coming for the food decide to rush for the food, let's not pretend that you are always in a position to have done this any better. It's when these things occur that you now want to change strategy. But definitely the food must go. And we all encounter that all the time. What we should not do is to begin to make it look as though maybe the decision to distribute the food itself was bad, or that unless you devised a strategy to distribute the food in a way, maybe send it to people's homes, which would have required a lot of infrastructure, a lot of arrangement. You need to make decisions in these difficult times. And therefore, if it comes out the way it did, the important thing is to improve it. I mean, when we say shambolic as though somebody was just reckless, I don't think it's helpful for the discussions at all. I repeat, the Ghana Health Service and those managing this pandemic for us have done well.
Okay.
They are not perfect. They have got it wrong at some points. But they got it wrong because they wanted to help. In the process, if they make mistakes, we're happy to point it out to them. It should be done in a spirit that says, you're doing well, but if you can fix this and this as well, it will be helpful. That is the attitude I take, and I commend government. Maybe because I'm part of government, I commend the president for the way we have handled this. The frontline workers, the Ghana Health Service, they have done marvelously well. Look, a lady told me that he's surprised to see this in Ghana because she traveled. The address she gave was her family house, and it was because that was she immediately remembered. And when it turned out that they had to trace her, they went to that family house in Koforidia or so. Then they gave the health service where she must be now. And then she was there when they came and said, this is why we have been following you. We went to the address you gave. And he says, she was just amazed that in Ghana we could be this competent.
There's a contact tracing.
Yeah, the contact tracing. Okay. So please, I'm saying that there could have been slips here and there. But overall, I think the health service people deserve commendation.
Right.
And let's not give the impression that they have done a bad job.
Well, what do you say to those who also say to part of his point about the management? Before the lockdown, the announcement of the lockdown, the manner in which it was announced, gave room 48 hours or so for people to decide to leave the urban areas. People were traveling all over the place. So you announced that there should not be movement. But before it kicks in, there is so much time for people in infected, jurisdictions to move and to travel all over the place. Some say that could even be perhaps the reason why some other places began to get infected, even though we do not have data that suggests that somebody traveled from this infected area and went to infect another place.
You need to remember something, that the management of this COVID-19, as the president said, is being led by data and science. You don't have time. You're weighing the consequences of a lockdown on the lives of human beings against the risk and what interventions are needed. Look, sometimes I feel sorry for our cabinet ministers because they are attending meetings almost every day. Anti-COVID-19 meetings are going on in the president almost every time. The experts are going there almost every time. Things are moving very quickly because while the president is careful to ensure that he does not announce a lockdown prematurely, because it has cost to people's lives, it has cost to the economy as a whole. So he's just waiting to get it just right. Once the data and the science advised that, look, we have come to a point where there has to be a lockdown, the president has to make a decision how much time I'm going to wait for the risk of infection to manifest before I announce this. The president said 48 hours. I think even if a longer time would have been appropriate, in the circumstances, it was the best that could be done. And again, let us realize that these are human beings dealing with this.
All right.
And when these things come, we just have to look at it and improve.
Let's go to our experts who are with us on Zoom. And I must repeat that the report attributed to the World Bank, the World Health Organization about the Ghana's ranking still cannot be confirmed as accurate from the WHO. The Deputy Health Minister, Okoboy, had an interaction with the leadership of the WHO, and after that, he spoke and gave that indication. And then the publications began to run around about Ghana being in that position. So that's how to put it more accurately. Yeah.
I'm sure the WHO, if they did not agree with this position, would have issued a disclaimer.
The minister would not have. They would have issued a disclaimer.
Yes, the minister would not have done that, and they would have issued a disclaimer.
Let's wait and see if they do so or they don't. So. Okay, thank you. Now let's go to the phones and begin with go to Zoom and begin with Dr. John Amwesi. Thank you once again. Now, listen to this. Listen to Dr. Insian Sare and listen to Badusa Kodie.
To 4th of May, that's yesterday, US, the mighty US, has 1,035,353 cases and 55,337 died, which means that their positivity rate is about 5.34%. If you come to Africa, South Africa, who is also tested, South Africa has tested nearly about 150 or 160,000. In fact, after South Africa, we are the next who have tested in raw numbers, more than anybody in Africa. South Africa has 6,336 positive cases, and 123 have lost their lives, which means the positivity rate 1.94%. Nigeria has 2,388 and 85 lost their lives, so positivity rate is about 3.6%. Ghana had 2,719 and 18 have lost their life, so the positivity, the mortality rate for Ghana is 0.66%, less than 1%. If you look at all the countries, in fact, the only country who have tested, and I'm sure they've tested only very few patients, that's Rwanda. We don't know the number that they've tested. They have 259 and they have no deaths. Ghana's mortality rate is 0.66%. So if you look at the dynamics, it means Ghana, in Africa, and almost in the whole world, we have one of the lowest, according to the number of tests that we have done, because we have done a lot of tests. So what it means is that in Ghana, the dynamics of the disease is quite different, even from the whole of the African sub-region. And for the whole world, our dynamics is quite different. That is because of the good measures that we put in place at the initial stages from the 15th of March till date, it doesn't mean that we are out of the doom. And if you look at even the numbers that we have, those who are well and responding to treatment, out of the 2,719, 88% of those people are well and responding to treatment either in the facilities or in isolation or at home. Somebody will ask, why is it that we have so low recovery and discharge patients? That is something we are doing in process. If you look at it, if you even look at the first few cases that you have, some of them are not in the country, but I'm sure they are all recovered and discharged at wherever they are. So we are gathering all these figures, and very soon we shall tell you how many people have been discharged or recovered out of, they don't have the virus and has been discharged. It doesn't mean that we are out of the doom. It means that we have to continue whatever measures we have put in place. What it means in Ghana is that we are lucky. We took a lot of measures early enough. So we should be very grateful to the Commander-in-Chief, His Excellency the President, for putting in these measures, which has a lot of social and economic problems, but he took it.
We started having a build. The first confirmed case in the country was on the 12th of March. Since then, those were from the people that we put together later, those that were put on quarantine. Out of the 1,030, within a short time, we had 115 of them. Those in quarantine at Accra here and also in Tamale. So we realized that with a sharp rise, and now with the cases that we are tested, clearly we seem as a country to be on top of the peak, and we are at the stage to decline. That is the observation now. The declination will depend on how we adhere to the various preventive etiquettes that have been enumerated. We are not off the hook yet, but then if we continue the way we are doing now, by adhering to the various social distancing, adhering to the various individual preventive measures, wearing of masks, keeping away a distance from others, hand washing, cough etiquettes, other respiratory etiquettes. These are the things, when we do intensively, will let us come down from where we are. So responding directly to the question, where you are at the peak of the curve, yet to come down. But then the only thing to make us come down by strict adherence to the various preventive etiquettes.
Dr. John Amwesi, how did you understand the Director of Public Health at the Ghana Health Service, Bedusa Akodie?
Thank you, Samson, and good morning to your listeners. Samson, if you'd allow me some time just to try and build the picture, because to be able to put my comments in context, I need to bring your listeners to a certain place. Again, I've always maintained, and thank you for having me again, that we will complement when it is necessary, and when we need to critique, we will also do so. This is the least that some of us as academics and independent scientists in our institutions, and I sit at the KNUST, can do. Now, it is clear that as of today, Ghana has just about the highest number of cases in West Africa. Now, this needs to be taken in context, because it's possible to have many more cases than your neighboring country or a country of similar socio-demographics, and yet have less deaths. And this is a very important thing to know. In Ghana, we have about 4,012 cases so far, some have recovered, and 18 deaths, 754 recoveries. If you look just to the west, you have Cote d'Ivoire, and in Cote d'Ivoire, you have 1,602 cases and 20 deaths. So that's 2 more than Ghana, but the proportion is much higher if you should do the math. 323 recoveries. In Nigeria, very close to Ghana, but a much bigger country, 3,912 cases and 117 deaths. Now, this is the West African picture. You can look at the same picture and how it's panned out in Europe, for example, in Germany, where you have 170,000 plus cases and just around 7,000 plus deaths. On the other hand, very similar number in France, 176,000 or so cases and 26,000 deaths, almost 3 times. So this tells you that you can have countries that may be very similar, very close to each other, and you may end up with very different pictures. Similar pictures with respect to numbers of infections, but very different pictures with respect to death. The fact that we're seeing much less deaths in Ghana than even our neighboring countries should tell you that we are doing something right. I think that every expert would agree on this. We are definitely doing something very right. Now, it's important that we do not focus on the number of cases going up. When I say do not focus on it, what I mean is it needs to be taken in context, because it is actually a good sign. And you need to allow me some time to explain why I say this. It's a good sign because the more testing you do, especially the kind of testing we're doing, which is the targeted testing, the more the cases you will see. So we have taken an approach which is more about seeking out who might have the disease, which is the targeted surveillance, and it has a huge influence on the prevalence that you will measure. So the question is, who are we testing? So it does not necessarily matter how many people you are testing, but who these people are, where they are. And we have focused on testing those who are potentially exposed. It's therefore not surprising that you will get a good number of positive cases. But what has borne out for us in this approach, what has helped us in this approach, is that we have had much less deaths. So it is because we are actively looking for those who might be potentially infected, you're able to get them earlier, address their illness, and ensure that they do not fall, terribly sick and therefore die. So it's very clear. You see the picture, we have less deaths because of our targeted approach. But what is happening in many other African countries is that they are really focusing on those who are presenting as being sick. They test them. And so you end up with the number of infections appearing much smaller, but then you have a higher percentage of people dying. And this is exactly what you're seeing. So the question is, how can we keep up with our enhanced contact tracing approach or our targeted surveillance approach as the infection continues to spread and more people become invariably exposed? So it means you cannot, maintain the approach that we are taking for now. It's the best approach in the interim, but moving forward, we need to change gears and we need to change fast. We did what we could do because we had limited tests and limited testing capacity. But we need to change those gears really, really fast. The reason is that we will otherwise lose the gains that we have made because we will no longer be in a position to catch people early, because there'll be many more people who have the disease, and the disease will start moving faster than we can, and we'll end up playing catch up. Now, I'll explain regarding the peaking issue. So what's happening, as I said, is that we're detecting more cases, but then we're telling people that these cases are on account of the expanded surveillance and not the expanded epidemic spread, when in fact we are not measuring the spread. So this is where I, as an academic, get a bit uncomfortable, because we are in fact showing just one part of the picture, which is true, and maybe perhaps turning a blind eye to the fact that we do not know what the other part of the picture looks like. And the fact is, or the painful thing is, that time will always reveal the true picture. So I see this akin to the proverbial story of the blind man and the elephant, where one will be holding the tail and saying it is a rope and professing strongly that it is a rope. And so we have one part of the story, and we have provided evidence that is almost incontrovertible to that part of the story. But we need to be clear with the fact that there is a bigger picture. And we cannot keep speaking to the rope part when we know very well there's another part that we just happen not to know now, because we are not measuring it. We're not measuring the actual rate of spread of the disease. So the curves that were presented, I'm now getting to the peaking issue, right, is actually the curve that is based on the results of our largely expanded targeted surveillance. So the question would be, what peak are we talking about here? All right. So we are presenting a peak which is actually reflecting numbers from our expanded surveillance. It is not reflecting the rate of spread of the disease. You want your peak to be based on your measurement of the rate of spread of the disease. When that is sustained, and then eventually you have the reproductive number, the R naught, which you've heard so much about, dropping below 0, that is when you would have eventually a decline. So to sum it up, what I'll tell you, something is, what has been presented is a certain type of peak, but it is only the peak of the picture from our expanded surveillance. We are not measuring the spread of the disease, and therefore we are not able to tell what the peak of that spread is and where we'll be going from there.
We cannot say that Dr. Bedu-Sarkodie was wrong about this. What is a peak? What is the standard definition for the peak? And, you know, people, including Kwame Sapong-Asiedu, have said it is a mathematical definition. And that definition is when your daily recoveries are more than your daily infections. So this graph, which tells us about advanced surveillance and, you know, samples that were taken long ago and don't get, you know, results within the same day, and to on that basis say we have peaked and expect to decline. Will you say that was a mispronouncement on the part of, you know, the team?
Samson, I think that's a great question. And let me come back to what I was talking about, which is the presentation of the picture. So the picture was presented by the Ghana Health Service, which I must say is an accurate picture based on what they have available and what they set out to do, which has been this enhanced, you know, tracking, testing, and treating. And when we speak of a peak in epidemiology, and I can tell you because I teach this as part of my work at KNUST, you can have many kinds of peaks. You can talk about the peak in terms of the rates of death. You can talk about a peak in terms of the rate of infections. You can talk about a peak in terms of rates of recovery, and in so many other ways.
What did we understand? What did we understand Dr. Bedu-Sarkodie to say in this regard? What sort of peak did he speak to?
I'll tell you what it is. I'll not tell you what he said. I'll tell you what it is based on the graph because I can interpret it. And what I'll tell you is that this is reflecting the picture of those who were contact traced, those we have actively surveilled and looked out for to a large extent. And this picture is only showing these kinds of people. We have not, and I stress again, we have not measured our rate of spread of the disease.
Right.
And really the most reliable kind of graph that you want, for which you can begin to speak of a peak and talk about a decline eventually in your infections, is in relation to the rate of spread of the disease. And this is when you want your reproductive number to go below the 1. This graph does not give you this information. And the comments that he passed regarding the peak were comments on this graph.
Okay. Let me bring in Kofi Kwache also to understand what his appreciation of this question of the peak, and that's such an excellent, you know, explanation you have given, very easy to comprehend from a layman's perspective and to work with. Now, Kofi, from where you sit, what are we doing wrong by this kind of projection of a peak, if we are doing anything wrong by that?
Okay. Good morning, Samson. Good morning to your esteemed panelists in the studio and to Dr. John Amwasi, an academic who I actually follow quite closely. I think when it comes to the issue of the peak, what the data that was presented, like Dr. Amwasi said, has to do with the amount of positive cases we are detecting over time, which itself is a function of the number of people we are testing over time. That's why it feeds directly into the question of the enhanced contact tracing. Now, again, that does not give you a full picture of exactly what is going on. The reason why the basic reproduction number is an interesting or it's a key variable really is because that is actually what determines how many new cases you have. And to actually track how the epidemic is progressing, what you're really looking at, the actual outcome variable ultimately you're looking at is how many active cases do you have per day. And the number of active cases you have per day is a function of the new cases you have, subtracting from that your recoveries and deaths per day. Now, if your reproduction number is slow, it means your new cases will come up slower, and your recoveries will catch up with that, or even supersede that over time. So you will start to see that when you do a histogram of your active cases per day, because the recoveries are outpacing the new cases, you start seeing the decline. So that classic kind of epidemic curve that we've been looking at, that bell-shaped curve, that's actually the outcome variable that we're looking at, the active cases. The basic reproduction number feeds into that because that's what determines the number of new cases you're getting. And then your management of the cases is what determines your mortality and your recoveries, which is how you get your active cases. Looking at just the number of new cases you get per day, while also ignoring the number of tests you've done, cannot actually tell you that you reached a peak. That's not how it works. And it's not possible also to conclude that you are approaching your peak if you're not seeing certain characteristics in the actual curve of the active cases. What you want to see is that you are having a deceleration over time leading up to your peak, so that over day by day, you are seeing a smaller percentage increase in your active cases. That lets you know that you are decelerating and approaching what could be a peak. But most countries don't even know they reached a peak until they've passed it, because that is the nature of the data analysis. You have to pass it, observe over time, and then say, okay, now that we've studied the dynamics of over maybe 3 or 4 days, maybe even a week, New York City, California, I know both looked at 2 weeks of data to make that conclusion. Then you can say, okay, now we have a situation where consistently the percentage change in our active cases is actually negative, and the percentage increase in our recoveries is going up. So we are getting a sustained downtrend. So we can say, okay, we have passed our peak. If you follow a lot of what's going on in Europe and the United States, that's kind of how the explanation has been made, that we have passed our peak. No one has really said we are at our peak or we're approaching our peak, because the nature of the data collection makes it hard to actually say that definitively. So especially if the insinuation from the graph that was provided was supposed to be that we were going to peak in terms of the pandemic, or the local epidemic here, then I think that was inaccurate. And it's important that that stuff be put in its proper context, because many people are evaluating their own risk perception based on those kind of statements. They are deciding what the extent of the threat out there is based on those kind of statements. So if we're not tight and very specific in our description of exactly what the key variables are and what they're telling us over time, the likelihood that the risk is that you're going to have people over-realize. I think we've seen that in some of the other issues. I think early on, a lot of the description of the epidemic was that it was a matter of imported cases who were tracking and tracing, which was true. In every country apart from China, it was a situation of imported cases. So if you're able to track the ones you're getting, trace them, test them, and isolate them, you would make some gains. But quite obviously, if you look at our data, for example, on March 20th, when we had 16 cases, 3 of them had no travel history and no confirmed contact with any infected person. So it was quite clear that even then we had local transmission going on. But framing it as a problem of travelers and importation can skew the perception in the general public about what the general local threat is. And one of the variables I look at where we are really is the routine surveillance cases, not just the enhanced contact tracing. The enhanced contact tracing, yes, it's aggressive, it goes out and finds people. But even then, it's a question of how you define the contact, like what Dr. Mwasi said. If you're not specific in the definition, you might bring in too many people who don't have epidemiologically relevant risk. But with the routine surveillance situation, what you're seeing there is people who have symptoms, who are walking into hospitals and are testing positive for COVID-19. And we've seen that number jump up almost 33% in the last 4 days. That speaks to the question that we have a significant amount of local transmission that our contact tracing effort is blind to, because the routine surveillance numbers are the people we don't expect to see. those are people we are not expecting to pick up. So if we're seeing that the active cases there go up, there are many reasons why we should be concerned. One of them being the fact that the active cases there are actually clinical cases. They are symptomatic and need care. So if we don't get a handle of that stuff quickly by assessing broadly, like Dr. Mwasi said, what our actual local spread is, to have a sense of what the health system risks are, we might find ourselves unpleasantly surprised by very, very aggressive jumps in that particular category. And that's where, especially for me, in a lot of the analysis I do, I look at the routine surveillance data and map that out, because you can clearly see there, for example, that it's like what Dr. Marcy pointed out, because those are people who are coming in later on in their disease progression, that's where we've actually recorded all our deaths. We recorded all 18 deaths from that routine surveillance population. But ironically, we've also recorded all the recoveries from that routine surveillance population. So quite clearly, we are doing something correct when it comes to the treatment, but there's also factually something going on. There's something to acknowledge there about the fact that we're seeing a low mortality rate so far might also be a function of the timing of when people are being tested and showing up.
Yeah, right.
If you look at the average incubation period being 30 days, then there's a risk that what we are looking at right now is a time-specific cohort mortality rate and not a broader question. So we should still keep our guard up and be aggressive in tackling this issue.
So, Dr. Amwesi, Dr. Ampofo of Noguchi, the director, also at this press conference to update the country on what was going on, indicated that it was your place, your center, KCCR, that had 1,982 samples awaiting testing. That was the backlog. And that would have been cleared by Thursday, some 3 days ago. How do we explain the numbers that has brought our total infections to 4,012 when this backlog had been cleared by Thursday?
Well, thanks for that, Samson. And I just want to say thanks also to Nana Kwachi for that beautiful expose on the numbers and trying to explain what they really mean. Now, with regard to the numbers that we're seeing now and the backlog of KCCR, I need to also acknowledge the great work that is being done here at my center at KCCR, Director Phillips, Professor Phillips, and the testing team led by Dr. Michael Owusu and Dr. Augustina Silverkin, working day and night on this to clear the backlog. And KCCR is a much smaller place than Noguchi, so to be able to do the kind of work we do, we really need to put in a lot. But that notwithstanding, I am not directly involved with the testing because I'm not a virologist.
Right.
And I can tell you that, yes, the backlog has been cleared, because this I confirmed personally with the testing team. There are pieces of information coming in from routine surveillance. There's information coming in from the enhanced contact tracing, which is still ongoing. And now when we talk about the enhanced contact tracing, you need to realize that it will include tracing of people who did not who came in contact with someone who did not necessarily have a travel history, which means that contact tracing does not end when we have been able to necessarily trace all those who traveled, because we will find someone who traveled, who passed infection on to someone who did not travel, who then passed infection to someone else who did not travel, and so on and so forth. So this will continue. So these the results from this kind of work will keep coming on and keep adding on to whatever backlog that we had. So until I have the fine detail of the numbers of how many were from an enhanced contact tracing, how many were from the backlog, how many were from routine surveillance, it's very, very hard for me to make any declarations or speak to the dynamics of the numbers. But Samson, I would encourage you to focus more on the interpretation of the numbers and the different categories of the numbers. And particularly what Nana talked about, which is what we're seeing regarding the numbers from the general surveillance, or what we call the in actual fact, it's a passive surveillance of some sort, really a passive surveillance. People who are sick, who walk in, who come in with complaints. If there's anything we need to focus on, this is it. And if the information that we have, which was provided by the Ghana Health Service regarding the 500 plus people who were infected from an industrial facility of about 1,500 plus people, that for me is exactly the reality we should be concerned about. Because if you have a workforce of 1,500 and something, and you have 1/3 catching the virus because they were exposed to someone who had it, that is the reality of what we are facing in our communities. And therefore, what we should anticipate is more numbers. Now, when I say anticipate more numbers...
Dr. Moisi, I'd like you to hold it on there for me. We will come back on the question that you say, what has been discovered at the industrial facility is a reflection of the reality in our communities. What does that mean for our fight going forward? We take a break. We'll be right back. Welcome back. This is Newsfile. It's your most authoritative news analysis platform. And we are canvassing for you first the issues about the coronavirus infections in Ghana, and then the matters of whether or not the country has peaked and was expected to begin a decline. Then the 3,000 and so suddenly hit 4,000 plus. And people are beginning to ask questions, and we are getting very good explanations as to what is happening. Let's go back to the phone lines and get our experts to assist us further. We go to the Zoom and get our experts to assist us further. Now, Dr. Joynews Moisi was giving us this explanation and then came to the question of the numbers that were that brought the update to 4,012, and we are told that this was a case where over 20% was as a result of an outbreak in an industrial facility with 1,300 workers, out of which 533 have been confirmed positive. 533 have been confirmed positive. He says this is a reflection of the reality in our communities. What does that mean? And what is expected from this kind of discovery? Dr. Moisi.
Hey, thanks for that, Samson. I like the way you journalists are able to latch on to stuff and, you know. but no, that statement, yeah, it's an important statement I made there because of a couple of things, and I'll explain. Now, if you look back at this epidemic globally, we had the concerns with the Diamond Princess cruise ships that had infections aboard. And the Diamond Princess cruise ship was that one place that helped a lot globally to establish some estimate of what their reproductive number was. This was because you had a well-defined, not only well-defined, but also a confined population within which you could measure the spread of the disease and even map out the levels of mobility and so on. We have seen this kind of picture also repeat itself and be used in other places. For example, in the US, at the meat packaging plants, Tyson meat packaging plants, where you had in some plants over 14% of the workers, coming down positive with coronavirus. There are three places where we tend to aggregate and associate very closely for a relatively long periods of time. One is at home, the second place is during our commute, and the third place is at work. So if we now have data which shows a fairly well-described population, which is a population of factory workers in an industrial site, over 1,300, I thought it was 1,500, but he said 1,300 plus, and we have 533, that is well over 1/3, falling ill. It should tell you what the reality of exposure and risk of infection is. And you can use that as a fair proxy of what the rate of spread would be within a community when there's one infected person. All you need to establish among those factory workers would be how many people were initially infected, who was the index case, or who were the first few cases. And then you look at the amount of time they spent together and the proximity they had with each other. And with that, you could even measure what your real rate of spread is. So I think this is really indicative of the reality. But I need to throw in a caveat there. The good thing here, again, is that this has been picked up quickly. What that means is that we know these people, they'll be isolated and they'll be treated. So it should not surprise you at all if the mortality from this now cohort of factory workers will be 0. And that's exactly what you want. You want to be able to detect your cases early, quickly. This is exactly what Germany has been able to do. And so far Ghana is doing, but we need to change the gears quickly. Germany has just as many infections as France. And yet less than 1/3 the level of mortality, or barely 1/3 the level of mortality as France. What is making the difference? It's the rate of testing, which allows you to detect very quickly and therefore to intervene among those who are positive. And remember, a greater majority will be asymptomatic. So it should tell you that we need to now move into a mass testing regime. I'm not in a right position to speak about our capacity to do that, but from what I understand, this is being worked on to increase the testing capacity. We have even developed in-house antibody antigen reaction test kits here at KNUST, which are being tested by the FDA. I don't know the outcomes of that. So there's a lot of activity around this. I don't know the full detail, but this is where the pressure should be put, because as for the rate of infections, it most likely will go up, and therefore you need to continue with the things we've talked about, the hand washing, the mask, and so on and so forth. But that only takes you to a certain point. But let me just go back to my main point, which was that yes, the picture that we saw in the factory is a reflection of the reality.
So let me bring in Nana Kofi Kwache here. That sort of mass numbers, so to speak, in that test, over 500 confirmed. What does that tell you of what we expect to do or what we should be doing going forward?
Well, again, the good thing is that we've detected that this cohort exists and that we are taking steps to identify them and to make sure that they're isolated and being treated. The thing that is quite clear from that is that these workers don't live at the factory.
Exactly.
They live in their communities. They have households, they have family members. And so it speaks to now a question of how aggressive and effective are we going to be at contact tracing. If we let up and we're not able to effectively follow up and track down all the contacts, 500 as a seeding reservoir is a big number. And we need to make sure that we're able to aggressively go out and identify all those contacts, trace and test them. But again, it does speak to, like Dr. Marty said, what is going on in the communities, the risk that actually exists in the communities. Because I would guess that the first case there is not somebody who traveled and came in. This is somebody probably who got infected in their community, took it to work, and it spread there. The idea that it has only happened at one place in the whole country, that's a little naive. We have to be honest with ourselves about it. And because of that, it's important that we begin to really get out there and attempt to estimate the extent of the spread. This is something that I think a lot of academics, a lot of researchers, a lot of independent-minded people have been saying from the beginning. Our testing strategy cannot be limited to just contact tracing on hospitals. We actually have to do an active, pretty wide-scale epidemiological study of what's going on in the country with regards to COVID-19. the rapid testing kits are really helpful there. It will allow us to really, what they do is give us a sense of people who have previously been infected or people who have late-stage infections. Then we can actually get a sense of where we stand. But
beyond enhancing the testing, are there any other things you have expectations should be done, because this may give an indication of the reality in the community infections?
Well, yeah, so it's not just a question of enhancing the testing. It's about doing an additional type of testing, which is community level screening, where we are doing a survey to figure out exactly what the extent of spread is. That's not just about enhancing. It's almost a different type over there.
Right.
But obviously, with regards to the actual strategy we're using right now, our contact tracing, that has to be absolutely impeccable right now. The room for error is really small now, right. And it's important that we really check those boxes.
Okay, give me just a minute, and Dr. Amosi, there are people who have expectations that because of the rise in the numbers of infections, the state should be rolling out some, stiffer, protocols again. There are some who are even thinking that maybe, some lockdowns may have to happen again.
No, thank you, Samson. It's really difficult to tell what will happen, and let alone what must be done. And I don't envy any leader or any decision maker at this time.
Yeah, what do you recommend?
Because of the gravity of the situation. And it's even more difficult when your vision is limited. And so you need to take very long decisions with long-lasting implications based on a limited amount of information. Now, that being said, I need to emphasize that the number of infections or the infection rate going up is not so much the issue for alarm, but our ability to quickly detect these cases and putting measures to treat them.
Okay.
So far, we've done right with this, and this is why we have a relatively lower mortality, even though we have much more cases, which is only to be expected. So having more cases is not the sole indicator for decision-making around restrictive measures. The restrictive measures are also a function of how much time you need to buy.
Okay.
Most of the restrictive measures that were put in place globally were largely because there was a need to ramp up hospital capacity. So you saw, stadia being converted into health facilities all over the world. You saw the mass production of ventilators and PPE and this kind of thing, because what you really want to do is to buy time. Now, when you have bought that time and you have what it takes to take care of those who are ill, then you can lift the lid. Now, when you lift the lid, you must be clear with everyone and say, hey, I've lifted the lid, take all these preventive measures on your own and so on and so forth, but the number of infections will go up. Nonetheless, we're ready, we've got you, we're going to take care of that. So if we have put in place all that we need to, we've ramped up our hospital capacity, our ventilators, and PPE and all that, then I would say don't rely only on the number of cases going up. Certainly don't tell people the number of cases will go down, because that's not true. And don't alarm them and say that everyone is going to die, because that also will not be true if you've put in place the right kind of measure.
Our place of some amount of safety and assurance, and our ability to now grab a hold of the disease by way of being able to isolate and test, is when we get close to, or we get to near real-time results, daily testing, and getting the results on a daily basis. Is that not so? When do you suspect we will get there?
No, Samson, you got that spot on. I mean, obviously, I cannot speak to when we will get there. This will be something that will rely directly with the Ministry of Health and the Ghana Health Service to speak to what we have done. What I can tell you is that there are a good number of facilities, research facilities and other facilities in Ghana which have the equipment that is needed to carry out the test, which is the PCR machines. There's also talk about the use of the machines that are used for the TB testing, which is called the Gene Expert, which can be repurposed for COVID. And these are almost in every district hospital. The tricky part is when you have a sample and you need to what we call inactivate the virus, you need to do this under special conditions. You need a special hood for that, or you need what we call a glove box. This is what we do not have in large numbers. Okay. I cannot tell how many are being brought in or the activities around ramping that up. Right. So I cannot speak to it directly, but what I can say is that the testing machines in themselves, we have a lot in Ghana, and a lot of effort is being made. Even research institutions like the Crop Research Institute is actually working on repurposing some of their machines to be able to do COVID testing. Right. But what is needed would be things like this glove box and the hoods. Great. So we ought to do this. I can't tell to what degree we've arrived there. I think you should ask directly to the Ministry of Health and Ghana.
We can't thank you enough once again, but like I indicated earlier, what will be your mask wearing protocol? In the course of the week, I have joined Webness, international and even national. I have seen speakers who are sitting in their rooms alone, in their offices alone, doing, a discussion on a webinar on Zoom and having their mask on. When do you wear yours? Why do you wear yours?
Samson, you asked a great question. And I think in public health communication, it's important to include that aspect of demonstration. And it's also important to recognize that not everybody will be able to appreciate, or we have varying levels of appreciation of the science behind some of the recommendations that we make. A good example is, and maybe I shouldn't go there. I'll change my mind right there. I could get into trouble with my breastfeeding experts. Okay. So I will not go there. But for example, wearing the mask is meant to protect you from possibly inhaling or getting the virus into your mouth or your nose. And also, if you have it, giving it to someone. So if you are on your own, obviously there is no one around you. So one could argue that there's no need to be wearing a mask. But the question is, if I'm using a common space and I'm not wearing my mask and I'm alone and I'm speaking like I'm speaking to you, and I have, some droplets falling all around the surface, and I leave and someone else comes and sits down and has their hands all over that surface, I'd have invariably spread the infection. I may have been alone while I was in that room, but because I did not wear a mask, I have ended up spreading it. So it is not just about being alone or being with people that need to wear a mask, but trying to really understand what the risks involved are. So for me, my recommendation would be that the blanket one would be to wear a mask as often as you can. Certainly when you are in public places, whether you are alone or not, when you are using public spaces or facilities, whether you are alone or not, and by all means, when you are in the company of others. Okay. Some maybe are taking it very far to even wearing face and nose masks at home. And I congratulate those who are able to do that. I'm not there yet. But it's important that this understanding about the use of the mask comes across very strongly. So what I would say is use a mask even if you're alone, if you're using or present in public spaces or public places. That's what I'll add to what is out there.
Thank you very much, Dr. John Amwesi, the KCCR. And let me get to Nana Kofi Kwache. So Nana, when do you wear your mask and how do you wear it?
For me, quite honestly, anytime I'm leaving home, I always make sure that I have it. Obviously, sometimes, it skips your mind, but what I do instead is I have my, fabric ones, and then I have in the car at all times a couple of the single-use ones in case I should forget. But anytime I'm going to any place where there is any chance of circulated air, going to buy groceries or anything, I'm going to wear the mask. Anytime there's a chance I'm going to interact with people, I wear the mask. And one of the things I try to do as much as possible is to always carry hand sanitizer with me, even when I'm wearing the mask, so that if it gets uncomfortable, I need to adjust it, I can clean my hands properly before I actually touch the mask.
Okay.
And try and fix it.
Do you wear your mask?
So that's basically my methodology.
Do you wear your mask when you sit in your car alone and you are driving to some place, or you get to the point where you need to engage in some service before you wear it?
Well, what I try to do as much as possible, just to prevent myself from touching the mask too many times or forgetting to sanitize the car or whatever, I just wear the mask before I actually get in the car. And I don't take it off until I get home. And when I get home, the first thing I do is throw it out, wash my hands, sanitize, and then wipe down the wheel and wipe down the gearbox to make sure that in case my hands come in contact with something inadvertently, at least I'm sanitizing the area. Okay.
Do you have your AC on and roll your glasses?
Yes. I mean, I'm still reacclimatizing, so the heat is a problem for me sometimes, so the AC is usually on.
Okay. Thank you very much for all of you for the contributions that you have made this morning, and our audiences are especially thankful because we can be sure that they have benefited a great deal. Nana Kofi Kwache is a research fellow, doctoral candidate, and adjunct assistant professor at New York University School of Global Public Health, studies health systems, health services, and health economics with a special focus on provider payment mechanisms and equity in access to care. Of course, if you have checked the list that was outdoored by the NDC as its team to advise and assist the government on this process, you will find his name there. Dr. John Amwesi is lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. Thank you all so very much, gentlemen. Right, so let me come back to the studio now. We will take another quick break, and when we return, we will be engaging on Dr. Baumia and Mohammed's, banter about who is best to manage your economy in crisis. Of course, Goku Kwarteng is here. Dr. Gideon Boako, spokesperson for the Vice President and his aide, will also join us. We have John Abdullahi Jinapo, MP Yape Kushogu, and member Finance and Mines and Energy Committees of Parliament. Before we take that break, Mr. Prasobani, after listening to the experts, what do you have to say?
We are not at anywhere at our peak right now. That's what I picked from the experts.
That's obvious.
And therefore, our Ghana Health Service leadership must revise their notes and come back with more accurate data, facts, and analysis, so that we citizens can go along with their leadership on the management of COVID-19. That's what I would say on that. In addition, I just want to point out a couple of things that came up earlier, which is the way food distribution was done earlier. And I still want to emphasize that you cannot have a humanitarian response without a plan. And from the onset of any crisis, such as this pandemic, if you think through a complete plan, you would necessarily target or note that there will be a consequence of a humanitarian action. And that humanitarian action dovetails the strategic response plan that you have done. So if we, on the onset, project that we will have a humanitarian action as an intervention, then we'll have to prepare whether it's food and other materials to support. But however, all these are not necessarily in terms of having direct contact with persons. For example, when the interventions on electricity and water, they didn't require those type of, they were done by institutions, that's fine. But where you need to do food distribution, you need to have a plan. Then secondly, authoritatively, I mean, I can say from now, from what I'm hearing, that WHO never said what the Honorable Deputy Minister said, that Ghana's plan or strategy was one of the best amongst us or something. That is also incorrect, and we're waiting for the WHO to come. And I think that some of these statements and utterances is a factor of confidence building.
Okay.
In crisis, without confidence building measures to bring along the citizens, the whole architecture of the response is questioned. And therefore, we'll have checkered approaches to knee-jerk responses to things as they emerge. And I think that we have to look at that. And then another point is that this thing is not about politics. It's not about government and opposition, but it's national crisis we are confronting.
Okay.
So when we make recommendations or interventions, it's not a critique. It is a submission of some opinion or points that should be considered or analyzed further and dealt with. It's not a matter of...
all right.
So we need to bring this national approach to the crisis. If we divide it, the recipe is going to be a failure.
All right.
We have to listen to all voices to ensure that we get this right. Finally, something, let me come on. We need to listen from the experts. We need to be cautious about community spreading. That is where the danger is. And I think we are gradually getting there. If we don't arrest it, the consequences cannot be properly managed.
Thank you very much. Of course, from what we are gathering, there's a huge, spread potential in the general population or in the community, and clusters like what we are hearing from this industrial, place, if certain measures are not taken. But what will be the measures? I'm sure that apart from what the doctors and the specialists, experts are suggesting, we will hear from the president what will happen tomorrow. Yes. So, Kukwating, you give us 1 minute of your conclusions, having listened to the experts.
Well, listening to the experts, I think it is clear that looking at the infection and mortality figures, that Ghana is doing something right. It's important that we commend those who are doing this. Of course, criticize where you have to. But where people deserve commendations, let it come from us as well. Let it not come from other commentators. And then in the name of contributing to the efforts of the state, all you can do is to say the very things that are not positive about our efforts. And then, Samson, I think it is important that we comment also on the statement by Dr. Bedusa Kodie. And if we go back to his response, which didn't appear when he played it, he was talking about a backlog of tests that had to be done. There had been a huge backlog. On the 25th of April, the tests that were done produced coming from the samples taken that day, produced the highest. And then subsequently, the tests that were done on the various days were coming down, which was reflected in the graph that was shown. So that his advice was that if we observed the social distancing requirements, we probably would have that as a peak. And the peak that he spoke about, that is what it referred to. I do not think he was suggesting somehow that Ghana, we are there, and therefore we can relax our guard. That is what I see. But in summary, all I can say is that we are in this fight together, and the work that is being done by especially our frontline health workers has been commendable. We urge them to continue. We should continue to even pray for the leadership of this country that they will have the wisdom to make the right decisions, that in the end, Ghana can confidently say, as many are saying of us, that we did handle this as best as we can.
Okay. Thank you very much. We take a break. When we return, we will deal with President Mahama and Dr. Bawumia, the Vice President's, banter about who is best placed to manage your economy in crisis. Dr. Gideon Boako and John Jinapa will join us, and then Kuku Kwateng makes a return to look at the IMF figures. Is there something to be concerned about?
It is always necessary when you're building an economy to have enough buffers and create fiscal space so that when you are faced with a shock or adversity, you are easily able to overcome it. Unfortunately, this government has used a lot of propaganda. They said the economy has been the best that we've ever had since independence. Unfortunately, just 1 month of coronavirus and the economy is in ICU. If we didn't run to the IMF for the 1 billion rapid credit facility, it is possible that in the next 2 months, probably salaries could not have been paid. And so our economy is on ventilators, and it needs thinking to rescue it from the ICU. And that is why we're continuing to review what government is doing. We're looking at what the figures are. I have my team working. We had worked with what was available to us before COVID, but we have to review that because next year, as the finance minister said, he says it's going to take 3 years for the economy to come back on its feet. And I remember that a leading member of this government told us our economy was so robust and we had such reserves that for 3 months, if anything happened to us, we will be able to survive. We've not been able to survive even 1 month. And so we will be able to recover our economy, and we're looking at, what to put in place in order that we're able to recover. But there are things that the government can do in the first place. One of the main things you do when you're faced with adversity like this and shocks to the economy is to cut expenditure, frivolous expenditure. And that's why I said this is the time to look for the president to look at the number of his ministers and appointees. Definitely the public service is bloated, especially political appointees. And when you're asking people to sacrifice, you must show that you're sacrificing yourself. You can't have appointees running all over the place and drawing free fuel, and thousands of them, just all over the place, 125 ministers, and you're asking the people to sacrifice. We're all going to sacrifice. It's going to take sacrifice to rebuild this economy. And the president and the government must show the first example that they're ready to sacrifice.
The NDC was in government for 8 years. They may think that we have short memories, but we can still remember very clearly that after 8 years that they had in office, in government, to demonstrate their prowess in managing this country and managing the economy. After 8 years, what did they leave us with? They left us with declining agriculture, declining industry, interest rates were high, inflation was high. In fact, if you look at the data in terms of macroeconomic performance in any economy, since the year 2000, the tenure of the former president was the worst in terms of outcomes in macroeconomic performance. That's the data, it's not me saying it. The banking system was weak. Unemployment was rising. Our national health insurance was back to cash and carry. We had 4 years of doomsday with its devastating impact on our economy. And not even withstanding that, electricity prices were being increased by an average of 45% between 2010 and 2015. Our public finances were in a precarious state, of course, that resulted in us having to go to the IMF for a bailout and policy credibility. Taxes were being increased. There was a freeze on public sector recruitment, cuts in allowances for teachers, and lecturers, cuts in allowances for lecturers, abolition of teacher training allowances, abolition of nursing training allowances, and even for teachers who had worked for 2-3 years, they were being paid just 3 months of allowances. I mean, common chalk was even a problem in our schools. And this is really the history that the NDC would want us to forget, and which we should not forget. Our memories should not be that short. We should remember what they did. And Nana Addo Dankwa Akufo-Addo took over the reins of government in 2017. After just over 3 years in office, he's been able to manage the transformation of this country, and we have been able to perform much, much better than the situation we inherited. In fact, the data is very clear. And so my humble advice to former President Mahama is to take a look at the data. This is not Green Book data. This is just the data, right? Take a look at the data before you speak. Otherwise, you will end up embarrassing yourself.
Right, so here in the studio is Gideon Boako. He's an economist. He's also the spokesperson for the vice president. He's 8th vice president. Now, John Jinapo, as you also know him, also has a good command over this subject matter, even though you may have known him to be associated with the power and energy sector. Yes. Thank you very much for joining us, gentlemen.
Thank you very much.
Right. So, after Dr. Bawumia gave that reply, he asked a direct question, and he answered it. Who will you trust with the management of your economy in times of crisis? And he said, looking at everything so far, very obviously, you will choose President Akufo-Addo. This has got the attention of everybody and has dominated discussions in the course of the week. John.
Okay, thank you. I thought you were going to ask
did Dr. Bawumia miss anything in his analysis?
Well, I'm happy that it's been situated within context, because the question is, who would you trust in times of crisis? Dr. Bawumia makes the claim that there were 2 crises and that we shouldn't distinguish the crises because both were crises. He says that the NDC crisis and the MPP crisis.
Internally generated, and one that is, a global, unforeseen, intervention.
So if you have your hydro drums dry, it cannot be internally generated. That's a fact. And everybody watching can tell you that if you have your hydro drums producing just about 30%, then it cannot be internally generated because you cannot predict precisely how your dams are going to dry. That is one. 2, if you have the fracturing of the West African gas pipeline, which supplies you with fuel, with the anchor of a ship, I don't know how an economist can come to the conclusion that you knew that that was going to happen and that you should have taken some measures.
Your dam drying up because of unpredictable, weather or rain, is become sort of a ritual, and so you should be able to make that prediction.
I'm giving you 2,
and make provision for when it happens.
Yes,
unlike Corona, you can't.
I'm giving you 2. I'm saying that 1, if your dams dry up, it's an external force. That's 1. 2, if there is a fracturing of your pipeline beneath the sea by a ship, I don't know how you could have anticipated that in order to deal with that.
Okay.
The most important thing issue is that when you are faced with a crisis or a situation, you have to take pragmatic steps to deal with that. And anybody who has done some level of energy economics will tell you that it takes about 3 years to get the necessary equipment in order to forestall whatever challenges you had. And like I've said, we had 3 major challenges when President Mahama took over as president. One was the issue of generation, 2 was the issue of financing, and 3 was the issue of fuel. And so the question you ask yourself is, how did you approach it? How did you deal with that? You and I know that the fuel issue was comprehensively dealt with the Atuabo gas processing plant. Today, it saves us about $350 million per annum in terms of input substitution. That is far thinking, that is forward thinking. That is dealing with the root cause of the challenge and not just dealing with palliative measures. And so that is highly commendable. So that fuel issue is a major, major step that President Mahama took. The other issue has to do with the generation itself. And I maintain that when President Mahama took over, and I have a document from the Energy Commission, which I'll refer to if it becomes necessary. If you were to have all the money, if you were to have all the fuel, at the time he took over in 2013, there was no way you could generate enough because the install capacity, and you don't even work with install capacity, but let me just deal with install capacity, was less than our projected peak demand. The install capacity was 2,200 at that time. Our projected peak demand was 3,000. So even if you were to fire all the thermal plants at that time, you simply will have a deficit. What it meant is that you needed some complementarity in terms of additional thermal plants. And he head-on dealt with it comprehensively to the extent that today we have enough capacity and with enough to export. I'm surprised that we are not exporting power. I think that by now we should be exporting more than we are doing. Then the third one.
Because that was part of the plan.
Yes, that was part of the plan. And we have started a program with Agence France de Développement on the balance sheet of Gridco to export 200 megawatts to Burkina by now. That program was stalled because their financials deteriorated from 2017, 18, and 19. And I have the records here. So the third one has to do with the financing issue.
But shouldn't, exportation of power be rather on the basis of source that is cheaper, hydro, rather than thermal?
No, you do a mix, a weighted mix. And I can tell you that Ghana is the 3rd cheapest in the sub-region. I have the documents here.
Okay, proceed.
I have a 2019 report from the African Development Bank.
Okay.
That did an analysis, and I can do that for you.
Okay.
And so this issue of Ghana's power is the most expensive, as was being touted, is flawed. The evidence is here, and I can refer to it if they challenge me. The third one has to do with the finance. Because even if you have the fuel, even if you have the thermal plants, and you don't put your utilities on a good pedestal in terms of their financial capability, you are simply going to go back to this situation. And so we have to come out with the energy sector levies. And today I'm happy that Gideon and Co are getting about 3 to 4 billion annually. Indeed, when we're handing over, we left money in the accounts. We had paid about 1 billion of that facility. It became a big issue, and everybody watching would attest that when we came with that levy, the NPP criticized us and stated that, look, it was a very nuisance tax, and promised that they would abolish it upon assumption of office. We can refer to that as well. Today, we know that they've not just maintained it, they've increased it. And so you are dealing with the financing, you are dealing with the fueling, and you are dealing with the capacity issues. And by the time President Mahama left office, I want to put it on record, 1 year before he left office, we never declared load shedding. We never. And the records are here with the Energy Commission and with Gridco. And see, it's not for me to say that load shedding is ended or is not ended. There are authoritative state institutions that declare load shedding over. And so it's not even for politicians to do that. And so if you tell me that you took over when we still had load shedding, the first question is, okay, when did you end it? You must have a terminal period. Because if you make the claim that, look, when you took over, load shedding was persistent, then you must tell us when you ended it.
Gideon is here. He's written an article on that aspect. He will try to convince us, because I am one of those who have had a difficulty understanding when the NPP says we ended Dumso.
I don't get it. And Dr. Bawumia is on record. He said, I think in February or March 2016, that Mahama deserves no credit for fixing Dumso. That is public knowledge. So I don't know how he's situating it. And I'm happy that my good friend Gideon is here, so that viewers can and listeners can follow the trajectory, how Dr. Bawumia wants to situate it. Now let's come to their period. We've had coronavirus, I think we are less than 2 months. So what are we comparing? Is it 2 months of your coronavirus to the 2 or 3 years that President Mahama had to deal with this challenge. The IMF, the World Bank, Bank of Ghana, and the ministry itself is projecting that will grow at 1.5%. So let's take Dr. Bawumia's statement to be true. When we had this challenge, we grew at about 3% or 3.6. I'll just refer. Now you are faced with a similar challenge, and you are projected to grow at 1.5. 2, if you look at, and we'll go into the real figures, even the data that Dr. Bawumia is referring to, you remember we've challenged the basis of those figures. And I'm sure that at the opportune time, myself and Gideon will get into the data and the figures. Because if we believe that your figures are flawed, if we believe that the data is inaccurate, it becomes difficult to do a comparison. Because you cannot compare flawed data with accurate data. You must compare apples with apples and oranges with oranges. The deficit, you've seen the projection for this year. The year hasn't even ended. You haven't taken the data. And so if you say that, look, compare Akufo-Addo with Mahama, and that Akufo-Addo is done better in terms of the management of the economy with COVID, and that Mahama did worse under a doomsday situation, you can only be comparing outturns. Because only when you have outturns, they will then be looking at the macro figures, looking at some other indicators, and saying that based on the outturns, your figures are better than that of mine. So I hold the view that what Dr. Bawumia did was absolutely, in my opinion, unnecessary. And if you subject it to proper scrutiny, you will come to the fact that you don't know exactly what he is comparing with in terms of the macro indicators. And so these are my preliminary comments. I'm sure when my good friend sets those parameters, then we can be doing the analysis and the discussion.
But the small one here, the small but big, you said that was forward thinking by President Mahama in respect of that Atuabo, gas processing plant. But that was a Mills project.
No, what I mean is
that part of the 3 billion Chinese loan.
The CDB facility.
Okay.
What I mean is that when you have a crisis, that even tells you that the crisis predates the Mahama administration. In fact, we have our first crisis in 19...
No, I'm saying specific because you said you attributed foresight to him. You attributed forward thinking to President Mahama when this was a Mills,
I'll deal with that. We had our first crisis in 1983, in 1998, and 2007. Then around 2012, during President Mills' time, we had a challenge. I know that President Mahama chaired that committee. I was a spokesperson. And he insisted that we shouldn't just look at the oil resource, but the gas resource had a very, very good potential in terms of helping us. But not just that. Let's put a turbo gas processing plant. The ENI project today is a game changer. And the ENI project gives us gas to fire the car power plant. We are thinking of working on a reverse to even come to this West-East Tema. That is President Mahama's project. He negotiated and did a lot in terms of the ENI project. So yes, collectively, and even as a country, sometimes we all share in that glory. But sometimes when you look at a person who really did a lot more, then finally, even the issue of the interventions that Dr. Bawumia mentioned, in terms of the food that was distributed, in terms of water, and the money to the health workers,
stimulus package.
Somebody had to sit and decide that, look, don't spend all your money. Let's establish an energy, PRMA, Petroleum Revenue Management Act. And in that act, let's ensure that monies accruing to the state, not less than 30% go into 2 funds, the Stabilization Fund and the Heritage Fund. Today, in this crisis, we've had to fall on the Stabilization Fund to help health workers, to provide water, to provide food, and all that. So even in taking credit, and I want Ghanaians to subject this to proper scrutiny, if President Mahama had not saved and accumulated those monies, it would have been very, very difficult, or the story would have been different.
So President Akufo-Addo is just like a spending officer coming to spend what, President Mahama, as you say, had accumulated, and therefore he cannot be said to be a better manager in crisis.
You've answered it, Samson. You've answered it.
I think it's interesting. So, Gideon, of course, until Bawumia replied, I'm sure not too many of us were talking about politicization of the process, but once he replied, it became an issue of why, you know, are we politicizing the COVID fight, which should not be the case. You have listened to, you know, John Jinafo. Clearly, the facts don't fully support the claims or the assertions by Dr. Bawumia, if you like. And they also fault his comparison that if you want to compare a crisis situation of pandemic, you should take it to Ebola and not to bring it to Doomsok. What do you say?
Yeah, thank you very much, Samson, and I'm privileged to be here this morning. Of course, I also extend my regards to my senior Deputy Minister, Kwaku Kwarteng, who was here earlier, and will come back later to deal with the third topic that is on for consideration. So I will speak briefly and in detail to this issue between the Vice President and Mr. Mahama.
And again, when John attributes the PRMA to President Mahama, again, I think we need to be situating, okay, because that's 2011, right?
Had to think.
Okay.
And institute that.
Okay.
And then when President Mahama took over,
right,
he accumulated this amount of money and
you.
bequeathed it to President Akufo-Addo.
Thank
so
you.
in terms of taking credit,
okay,
it's a trajectory.
Okay, so you want to say the NDC regime. Thank you.
Fine.
Yes.
So, like he also said, until the Vice President spoke, more or less, the issue of politicization of COVID-19 had not generated national debate. And for that matter, I would say the analysis we are doing based on what the Vice President said must be situated within context and draw the antecedents to that. You realize that since the beginning of COVID-19, government officials led by the President have done their best, tried as much as possible to rally the entirety of the Ghanaian community behind them to find lasting solutions to that. At no point has government tried to politicize the COVID-19, its management, and the way forward. But if you flip the coin, you could see a deliberate attempt from our friends in the NDC, led by their party leaders, and the leader of the opposition, Mr. Mahama, who has had the opportunity to be a president before. And I say this because even at the time that the president announced the lockdown, we had the General Secretary of the NDC, Mr. Johnson Asidun Ketia, affectionately known as General Mosquito, come out to address the press, and we saw the videos all out, to suggest that the lockdown announced by government and the president is nothing but a clandestine move to rig the election through the Electoral Commission. It was a bit surprising to a lot of Ghanaians, but that was the mindset that was demonstrated by the NDC through their General Secretary. It did not end there.
Well, as we speak, the Electoral Commission and its processes towards compiling a new voters register, among others, have become a subject of a court suit. Exactly. I think just yesterday there was a suit against them. The biometric verification machines that they are seeking to procure and everything, someone is seeking to stop them from doing it. And the new law that they are seeking to have, which will not include certain other identifiers for registration, is also being challenged in the courts. Let's see how all that goes.
So thanks for that information. But it still does not absolve Mr. Johnson Asidun Ketia from the fact that he was trying to politicize the whole matter of an action taken by government that has no bearing to do with the Electoral Commission. That aside, we had the Member of Parliament on the ticket of the NDC, my good sister, Dr. Zanato Rollins, come out to make wild allegations that government is politicizing the distribution of food, and that if you did not hold the New Patriotic Party card, you are not given food. This was a big untruth. But it was, again, an attempt by the NDC to politicize the whole COVID-19 and also throw shades at government. Then we had the whole NDC come out, led by Mr. Mahama, to say that they have also set up their own COVID-19 management or monitoring team of which my good friend at New York, Dr. Kwache, is part of. And so you could see there was an attempt by the NDC to kind of also create some parallel governance structure, what I call COVID-19 parallel governance structure. And this is highly unbecoming of any opposition party across the globe in terms of the management of COVID-19. I have not heard any country where opposition political parties are setting up management or monitoring structures separate from what the government is doing.
That doesn't make it wrong, does it?
Well,
but they announced. They said their intention was to contribute.
But we can critique it. We can also subject it to interrogation as to what was the motive. Couldn't they have rallied behind government just as all other institutions and corporate bodies are doing? And if we tie that one in to the two I have mentioned about Mr. Seydou Nketiah's and Dr. Rollins' commentary by members of the NDC and Mr. Mahama's attempt to also either precede President Akufo-Addo's address to the nation or address the nation after President Akufo-Addo has spoken any time the president was supposed to speak. And you remember, even when the president spoke, addressed the nation and announced measures, mitigating measures that his government was putting in place to ameliorate the sufferings of the people, our brothers from the NDC quickly jumped to the radio station and television station to say that, oh, the president is copying President Mahama's idea, because before he had spoken, Mr. Mahama had also addressed the press and put forward these measures. So there was a deliberate attempt by the NDC and Mr. Mahama to politicize COVID-19, throw shades at government. And in the comments of Mr. Mahama, he just played one. He says that, oh, government is not doing well. Government is performing so abysmally. If you look at the measures government is putting in place, they are not the best of measures. The economy is on its knees. We are scrambling and all of that. That was politics. Nobody can say that those comments, the actions of former President Mahama and his party were not an attempt to politicize the
That was politics because he's a politician.
Because he's a politician.
Or you're saying that if something is going wrong or somebody sees something they have to critique about the management, they shouldn't critique it.
Fair enough. They have the right to critique it. And that same right to critique must also be made available to whoever is governing and managing. I agree with you, like Lord Dennis said. Silence is not an option when things are ill done. And Martin Luther King Jr. has also said, I should paraphrase him, that we may all have to repent, not merely because of the vitriolic words and actions of the bad people, but the appalling silence of the good ones. So if something is going wrong, we have the right to talk about. But you should not assume that views expressed by the one criticizing should be sacrosanct.
Of course not.
The person you are criticizing equally has the right and the mandate to also subject your critique to interrogation. And so the vice president said, you have used about 2 months or so to criticize government's approach towards COVID-19 and its management. You have thrown shades at government. We also have to let the people know, and mind you, the government, led by the commander-in-chief of the Ghana Armed Forces and the president of the state, Mr. Akufo-Addo, President Akufo-Addo, has the right, one, to protect Ghanaians. He has the right to manage the economy. He equally has the right to correct any misinformation that is put out there, because one cannot also underestimate the negative effects of negative news on the management of the economy, on the progress of the economy. So the vice president came out to say that if indeed Mr. Mahama wants to present to Ghanaians that if he were in charge, he was going to manage this better than government has done, the thing is that the acid test to any political decision is what is the alternative. And so if you think you are the alternative, then we can only judge you by what you have done before and the opportunity that you have had.
Okay.
And if we cast our minds back and situate the argument within this decade or the last decade, Ghanaians can readily recall 2 major crises that have befallen the country. One is Dumso, which has been described as internal. You can challenge it whichever way you want to look at it. But I describe it as a crisis that was presented to us as a result of the incompetence and inefficiencies of a government, and that is Mr. Mahama's government. Then 2, we have COVID-19, which has been touted or described as a global pandemic, and the source or the origination of it has nothing to do with government or whatever incestuous policies that we have within our account.
That's where they say you compare, apples with oranges, because you should have gone to Ebola and how President Mohamed's regime managed it.
And that is why I say that, with all due respect, that cannot be right. And they are only trying to strike a difference where there is no distinction. How can we compare COVID-19 that has had serious debilitating effect on the Ghanaian people, their pockets, their businesses, and the economy, to Ebola, which was never recorded in this country, and by extension, even if had effects on us, it could be latent. Okay? So Vice President Bawumia situated the two within an argument. He was not comparing the two as crises that have been fallen under two different sectors. The sector, whether health, crisis can be flood crisis, it can be farming, it can be bushfire, it can be energy related, it can be health related. The sector that the crisis falls within, or where it is coming from at this point, is immaterial. What is of material substance at this particular point in time is whether or not the crisis had effects on the people and how they have been managed. Okay. Now, in the management, there are two approaches. The first is to look at it at the national or global level. How do I deal with this crisis? And nobody can say that President Akufo-Addo has not put in measures to deal with the crisis, or Mr. Mahama or whoever had a crisis in his period did not put in measures to deal with the crisis. That one, every government will try to do so. The second leg of it is going the extra mile to make sure that once you are dealing with the crisis, to find lasting solution and antidote to the crisis, the people who along the line have been affected by the crisis, what are you doing for them? And that was a contest within Mr. Bawumia's argument. And let us not get him out of context. And let no one try to set his or her own questions and answer them. In paragraph 14 of the statement put up by Vice President Bawumia, if you go to the second leg of the sentence, he says that what mitigation measures did they provide, referring to the NDC and Mr. Mahama, for businesses and individuals during Dumso? That was the context. So he says that, look, whichever measures you think you put in place to solve Dumso, whether it was successful and Dumso ended or not, Ghanaians can judge. But here within this context, I want you to tell the Ghanaian people, that aside those measures you say you put in place, what mitigation measures did you put in place to cushion businesses, to cushion individuals who were losing their money, who were losing their jobs, and businesses that were collapsing? Right. And let us put that within context. And here I say this. During Dumso, Ghanaians were suffering. I've had a chance to debate my brother John, where at some point he said, no business collapse under Dumso. Another point, they want to change their mouth. If I should refer you to a research that was conducted by the Institute of Statistical, Social and Economic Research.
No, businesses collapse. We are aware
at the
of
University
that.
of Ghana. Yeah. There is no ambiguity or doubt on the fact that businesses collapse. Right. I've also heard people say, particularly coming from the NDC, say that the two are incomparable because one is affecting lives. People are dying. That is COVID-19. Dumso did not lead to the claim of lives. And that is quite preposterous. And it beats my imagination. Why? During the period of Dumso, there were people who had to resort to the use of generators and suffered suffocation from the fumes from the generators and lost their lives. There were people who, in their attempt to run away from the heat that were burning their bodies and their souls, had to go and live on top of stories that were uncompleted, had to fall down and die. There were people who were sent to the hospitals and had to be put on ventilators. Because there was no power to power the ventilators, they could not get proper oxygen and they died. So that argument is dead on arrival. But let's look at what Mr. Mahama did during the period of Dumso. In the time of Dumso, where Ghanaians were suffering, businesses were collapsing, people could not find their way to make sure that their businesses were running, and therefore their disposable and discretionary income were going down. At the same time, so insensitive of the Mahama administration, they were increasing electricity prices. Indeed, electricity prices went up as high as 78% in 2013. It went up as high as 28% in 2014. And at the peak of Dumso, electricity prices went up as high as 59%. With government in the right senses and being so sensitive to the people, will increase electricity prices for people at the time that they are not getting the electricity and they have to look for alternatives to use generators and buy fuel. And at the same time, fuel prices will increase. At the time that they were doing so, and people were losing their jobs and their income, and they could not support their children's education. And the very few who had children going to the teacher training colleges and the nursing training colleges and were given some allowances that were instituted by Mr. Kufuor, not even Mahama, he came to inherit that. Mr. Mahama and the NDC looked into the faces of the miserable Ghanaian people. And at the time of doing so, that businesses were down, cancelled teacher training allowances, cancelled nursing training allowances. At the same time, businesses were down. Health professionals, nurses will go to the wards. There's no electricity to power fans or air conditions. They were living in heat. Doctors were sitting in their consulting rooms, battered by heat. Lab technicians were sitting in their laboratories, battered by heat.
We know that some were using mobile phone lights to
at the same time,
conduct surgeries.
Import duty waiver that was instituted by President Kufuor for health professionals was cancelled by Mr. Mahama. At the time that Dunso was on, and people were suffering, cold store people were losing their businesses, okay? Welders were losing their businesses, hairdressers were losing their businesses, seamstresses were losing their businesses. We were increasing costs, business costs, running costs for them.
So your point is
that... And there were no mitigation measures. And worst of it all, book and research allowance for lecturers were cancelled the same period.
I see.
Teachers who had been employed and taught for 3 to 4 years were only paid 3 months of their salary. That is an insensitivity to the nth degree for a period that Ghanaians were going through austerity, Ghanaians were going through hardships. People wanted to see proper mitigating measures by the government.
The same? And are they situations that you can compare in the manner you are doing?
Why not? Because...
So if you're talking about, government giving food to the vulnerable, it's because people can't go to work. They can't earn. Practically, the state has issued a lockdown measure that says don't go out, don't go to work. Since you are not going to work, you won't get money, you won't be able to feed yourself. So the government says, I will provide food. How do you compare that to the Dumso situation? Water bills taking up for 3 months, electricity bills for Lifeline taking up for 3 months and 50% for others. Is the context not completely different because you are unable to earn practically because the government says stay home, don't go to work? Is that not different from the Dumso situation where people are able to find alternatives to earn a living?
The difference is not there. And I know you're a lawyer, but you have some appreciation for mathematics. If I give you figures, I give you -3, I give you 5, and I give you 4, I will want to talk about, I don't have to look at the magnitude or the size of those numbers. -3, 5, and 4, I will tell you the resultant effect. The resultant effect is that you have -7 and 5, and therefore the resultant effect is negative.
Okay.
Okay? In the same vein, if I miss different numbers for you, what constitutes or forms the component of what is within the basket of the numbers is immaterial. What matters is the resultant effect. So during some period, 5 people were going to work. And I lived in Kumasi. I had people who were going to work, working for printing press at Asafo, Dichamsu and Krofrom. They were going to work all right. So you could see people going to work. But were they doing work? They go and sit down the whole day because there's no electricity to power their generators, okay? For them to print. Resultant effect is that work done is 0, income is 0, and nothing was coming at home. That is the resultant effect. The nature of going to work doesn't matter. In COVID-19, people are not going to work. They are sitting at home. That is immaterial. The resultant effect is that work is 0, income is 0, businesses are going down. Okay. So we have to talk about the resultant effect. And that is what Mr. Bawumia is talking about. That look, whether it is energy crisis or famine or flood is immaterial. How long it has existed doesn't matter. What matters most is whether or not it has effects, negative consequences on the people, and if indeed it has negative consequences on the people, how have they been dealt with in respect of providing cushions for the people. And I've enumerated to you.
And how does he also explain or answer the question that is being asked? We are talking about a health situation, a pandemic that is killed in excess of 270,000 people across the globe, infected in excess of 4 million people. In Ghana, you are talking about 18 people dying. Even one person losing their life is serious enough. How do you compare that to the electricity situation? People are asking, should a vice president, someone in charge of the management of the economy, be doing this kind of comparisons? How does he answer that?
The vice president was right to do that because, just as you rightly said from the beginning, that Mr. Mahama is a politician and therefore has the right to do politics, to take political expediency and capital out of whatever happens. We shouldn't also forget that Mr. Akufo-Addo and Mahmoud Bawumia did not get to where they are because they were followers of a catechist of a church or members of a choir brigade. They are here because they rode on the back of politics to seek political mandate from the people.
And are seeking
political mandate. And this is an election year. So whilst they are doing all the good things they are doing, it cannot be right that we force them or coerce them to keep quiet. Okay, Mr. Do Good, we are doing the good things we are doing. The opposition is behind you, destroying the matters for you. By the time you realize, as the gentleman said in his good joke, by the time you get to June, everything is spot for you.
People were saying on Twitter and elsewhere that you are in charge of the management. Just focus.
We are focused.
Focus. If someone is up to mischief, the people will see that for themselves.
I bet you in our political space, it doesn't work like that. In our political space, we devote majority of the time to focus. And in fact, I had to rush from PDRC and come here since yesterday. President, government officials, we've been there working, planning, strategizing. In fact, if the rep of your press corps was there when Mr. Bawumia spoke, he didn't even speak for more than 20 minutes, okay? But the NDC and Mr. Mahama had done their propaganda for well over 2 months, and nobody had responded to them. So I think the call by a certain portion of the Ghanaian society that, oh, okay, sometimes don't pay attention to the detractors, that one, a very genuine call, we agree to that. But they should also bear with us as a government, that they trusted us. It is because they believe this government can deliver that they repose their confidence in the president and his team. And that confidence they repose in us, whilst we have to work to make sure we deliver, there's also the need for us to make sure that whoever is trying to use negative news and propaganda to derail the efforts that we are making, for which consequentially could affect our fortunes of winning the next elections, we have the right to respond to them. And that is politics. That is accepted across the globe. There's no political leader who sits down unconcerned and allows the opposition to throw shades at it and doesn't respond to it. Government had to respond. The good thing is that Mr. Bawumia responded to this in a very respectable manner. He did not insult anybody. He did not use vulgar language. He did not attack like we have seen the trooping of a beehive of arrogant attackers coming from the NDC, casting all aspersions and using negative words, unprintable words on Vice President Bawumia. That is not what we are interested in. What we are interested in is that when they come to attack us and insult, we will distill and throw away the insult from the substance and deal with the substance.
And let me get to John because
because he's spoken for more than
no.
I hope I'll get
again. Let's not get there. And I took your note because you alerted me to that.
Please, thank you.
You see, when you are speaking, often you are not checking the time yourself.
Sometimes I do. I do.
Okay.
And I'm sure viewers too.
All right. So let's proceed.
Yes, please.
Now, President Mahama has been speaking occasionally, and as a responsible, leader, he's expected to galvanize people, like Gideon said, so that they will all do the right things and support the president, support the leader who is at the forefront, who is, expecting, a unified front to ensure that we win this fight against COVID-19. So why will he be giving focus and primacy to these questions that he brought up, which has attracted a response?
Thank you. Samson, first of all, is it not true that the economy is challenged? Is it not true that the economy is an intensive care unit? Is it not true that all the underlying factors and the underlying assumptions is derailed?
All the economies in the world have gone to sleep.
So what is it?
No, but when you say it is someone being incompetent, when it's a global situation.
Let me deal with some. I'm coming there.
Even the economy of the United States of America has gone to sleep. So
go
what's the
and
point?
check South Africa. With their energy crisis, they grew at negative. Go and check South Africa, mighty South Africa, with the same energy crisis. They grew at negative. With energy crisis, Ghana grew at positive. That is the difference between Mahama and Akufo-Addo. But let me just deal with some few issues that Gideon has raised. He says that Mahama was so insensitive that he even canceled book and research allowance. This is July 16, 2016. GNA. Government of Ghana has released 37 million to the Controller and Accountant General's Department for onwards disbursement as book and research allowances for the public universities. And yet Gideon comes sit here and peddles blatant falsehood. Sure. Blatant falsehood on truth.
Was it cancelled?
I think the problem at the time,
spare us this.
The problem at the
when
time
you had your time,
was the attempt to create a certain national.
You don't even understand what we did. That's why you are doing that. Can I make my point? I want to take all your issues one after the other.
Where the book allowances will be channeled. I think that was the issue.
And I gave you enough time. I disagreed with a lot of the issues you put out, including inaccuracies. I've just pointed to you that what
so you have pointed out that.
It's false.
Let's continue.
Next time, check your facts before you do that. 2, he says that I said that no business collapse. That's equally false.
Oh, I was on the phone with
Please,
you.
can I make my point, Gideon? The way you believe in your statement, that's the same way I believe in my statement. You made a statement that during the Doomsday days, a lot of businesses collapsed. And I said, how many businesses? Because you are in government. And you refer to this document from the University of Ghana. I've read the document from A to Z. There's nowhere in that document, and I'm putting it on record, where the document talks about businesses that collapsed.
But we know that businesses collapsed.
Businesses are collapsing today. Businesses will collapse tomorrow. But until you do a proper research, like the Institute did, and talked about the cost to businesses, then as policymakers, we'll be seized with the facts and we'll be making informed decisions. When I asked him, he said his uncle or somebody at a magazine lost his job. And I said, that is fallacious. What kind of assumption is that? You are in government. What you should have done by now is to give us the figures.
I think the
that was
question
conducted the research.
Is about the response.
I'm coming there.
Mitigating measures. We were all in this country. I ran a law firm. It wasn't easy to run the law firm because you need to buy fuel all the time.
I have just
so the question is, there has been reprieve for electricity consumers. What was done? What could have been done?
I have just enumerated 3 interventions that we did. I don't think that Gideon expected us to deliver free water. Electricity. In 2015, we reduced electricity tariffs by 12%. The record is here. If it's not factual, debate it.
The businesses that,
I am saying that
stimulus package. That's what he's telling you.
What have they done?
Good for
Who have they given a stimulus package? Who have they given a stimulus package?
You're not aware?
Who? Tell me here. Who has been given a stimulus package? We approved this facility over a month now. As we speak.
Oh, but that's a given. It's going to be done.
Nothing has happened. You asked me what.
The NDSS is going to have to do their allocations and give it to those. They say they are doing assessment. They will give it to them, won't they?
Thank you, Samson. I will deal with that. But I would like to build on my points. I have a lot of points. If you allow me, I'll come to all this. I'm building a point, and I'm making some analysis. So I'll take all the issues.
Okay. So no, you will spend some 3 minutes for your reaction.
Samson, that would be very unfair.
No, you can't. You couldn't have started and done 20 minutes and come back to do another 20 minutes.
Wow.
We are dealing with time.
Wow.
Yes.
So I'm saying that on record, that we reduced electricity tariffs. We didn't go to the IMF to borrow money. We didn't go to the World Bank to borrow money. That tells you that we are better managers than you are. That's record. I'm stating, go and check the 2016 budget. We supported even the pharmaceutical industry alone with $45 million. We did not go to borrow money like you are doing. Now you say that, look, what did you do in terms of fuel? Check 2016. We held fuel prices at a check. because we retooled BOST, and BOST was able to store fuel, buy fuel when prices are low, and release them when prices are high. To the extent that the importers were complaining that BOST was undercutting them. That is what visionary leaders do. Visionary leaders don't go and dip their hands in stabilization fund to the extent that you want to dip your hands in the heritage fund and come around and say that we should clap for you. What did Muhammad do? Dispute the things I'm talking about. That Muhammad did A, B, C, D. I've listed them. That is how we do analysis. You just don't peddle falsehood and present them and think that, look, he talks about Siedin Ketia. He's been vindicated. Did you not complain about the NIA? I sat with you. You complain about it. To the extent that the NIA says that they were doing that because of elections. So if a Siedin Ketia says that you were doing that, that is it. Now the issue of Zenato. Who did not watch the TV? You handed all the contracts to your women organizers and they mismanaged it. Just yesterday, the newspapers reported that they are investigating some people in Kumasi because the food has found its way into KJTR market. Simple money, we give you 80 million, distribute the food. Dr. Bawumia cannot supervise that. He cannot. And yet you tell us that you are better managers than we are. PPEs, common PPEs. And I'm happy we brought the issue of Ebola. Ladies and gentlemen, the difference between Akufo-Addo and President Mahama is that when we're faced with Ebola, President Mahama stayed in this country, commandeered all the resources, and ensured that we defeated it head on. We prevented Ebola from entering this country. When we were confronted with this situation,
was it not like some say
Akufo-Addo was flying from country to country? Sheer luck. When you have Mahama at the helm of affairs, dealing with issues, taking pragmatic measures, ensuring that the right thing is done, to the extent that the UN and all the agencies commended him. And yet you, when you were faced with a similar issue, he was flying from Switzerland to Norway to UK and jollying around. You could not manage it. The diseases engulfed us. Today alone, we are seeing a huge spike. And you are here telling us that we should praise you. Praise you for your incompetence and indecisiveness.
Interesting.
Finally.
The incompetence tag, I don't know who it will stick.
Finally. I think it's important.
And that's really finally
yes.
in some 30
he says
seconds.
That, what did
what
you
do you have to say?
I just enumerated to you. For instance, we brought on board a plan known as the KTPP plant. We didn't go borrowing. You told us that borrowing was a lazy man's option. What has changed? 3 weeks, just 3 weeks. You've gone to the IMF with cap in arms to borrow money. And even with that, you present fictitious figures. And yet you tell us that you are better managers of the economy. In any case, there's a fact that we grew the economy at over 3%. Under the same crisis.
Interesting.
What are you doing? You're doing 1.5.
Yes.
You want to compare your 1.5 to 3%? What is the debt to GDP?
Well,
you've moved it to 63.
Well,
even before
Thank you, John.
Your CD depreciated by 12.9. And yet you have the effrontery to say that NDC people are arrogant and that we arrogantly talk about Dr. Bawumia.
Okay.
Why is Dr. Bawumia a demigod?
So as we understood,
that we can criticize him.
As we understood by, say, a report of the Daily Graphic, 885 SMEs lost 250 million within the 4-year period of the Dumso.
Now we are dealing with
they didn't get any stimulus package.
You.
Nothing. Okay.
So
Gideon is telling you what Dr. Bawumia is talking about is there for everybody to see. We just began with the coronavirus, fight. And even ahead of getting to know what exactly the figures will be as far as the effect on businesses, there is a stimulus package, and they are supposed to assess it. That was not done. That, he tells you, is the difference.
So, did you listen to me?
When Bawumia makes this analysis, what is his invitation to Ghanaians? So we should do what?
So
after all, that's our tax money all of you use. So what's the point?
Yeah, the invitation to Ghanaians is that the Vice President respects the political mandate that was given to President Akufo-Addo and the NPP by Ghanaians. And that mandate was so overwhelming that in the annals of our political history since 1992, there has not been such high margin of electoral victory. And so whilst government is at work delivering and making sure that Ghanaians are okay, when you have political elements who have had a chance to be with us and root us in the not too distant future, in the past, trying to do all within their possible means to destroy the gains that have been made, there is always the need to make sure that the wrong information is corrected. And that is what Dr. Bawumia did. Of course, he is not a demigod, as John is trying to ask rhetorically. Dr. Bawumia is not a demigod. All right. He's a Ghanaian and astute economist who knows his onions and is supporting His Excellency the President to deliver. He says that we went to borrow in the midst of challenges. Yeah. I'm so ashamed.
President Mahama said that you didn't even wait for a week.
I'm so ashamed.
You said the economy was in good shape, was robust. And yet, when the crisis came...
It will be so imprudent on the part of any business manager to say that I've been hit hard by external crisis and I won't seek the right sources of funds. Please, to inject into the business. The kind of funds. When you went to the IMF, please, just a second.
I have to go for the break.
Just a second.
Thank you very much.
The difference in your borrowing is that this money we got from the IMF, it's not imposing conditionalities on us.
Yes,
that's right. You borrow from the IMF.
Thank you very much. Thank you.
It is not imposing conditionalities.
Have you borrowed? Why don't you mobilize in that?
You're welcome back. This is Newsfile, and this is an extended edition. We have some 30 minutes more so that we can deal with the other, issue about whether or not our government has been dishonest and insincere with us when it comes to the economic figures. Right. So Kweku Kwateng is back, as I indicated to you earlier, and then John Jinapo is still here. Joining us live via Zoom is Albert Tona Mama, IMF country representative. And as you have followed the situation so far, there is the claim, or the figures as you can see them, have been bandied about as that the government of Ghana has been telling us different macroeconomic figures locally, and then in approaching the IMF for the funds that it has gotten from the COVID, it used completely different figures that also suggest that the economic situation is not as good as we have been told back at home. There has been some explanations going on. Let's begin with the IMF's country director. Thank you very much for joining us, sir.
Thank you for having me. Good afternoon, Samson. Good afternoon to your panelists.
Right. So I'm sure that you have followed this back and forth as a result of the two contrasting figures, and also the Ghana, Fact Check Ghana has done and confirmed that in fact there were different figures submitted at home and different figures submitted to the IMF. What's the explanation?
First, let me commend you for reaching out. I think that's the right thing to do. We try as much as possible to stay out of these public debates. I think we felt compelled here to accept the call from the Newsfile just to clarify a statement made by Fact Check Ghana,
right,
which seems to be a Twitter accredited account. They basically say, and I quote, the data presented by the government to the IMF are different from those in budget statement, end quote. And here I would just like to focus on two metrics, the fiscal deficit and the gross international reserve. In our report, we present, if I start with the fiscal deficit, we present two measures of the fiscal deficit, with and without financial sector cost and energy sector payments. It appears that the number that are making the rounds, and excuse me if I've not been able to follow, because as much as this has been an important debate, there are really more serious things taking place that are taking up our time, right? So let me just make that point clear.
Right.
So we present the deficit with and without financial sector payments and energy sector payments. So the comparison that I see making the round is comparing two different things on one side, and we are aware of these differences, right? They are not new. I think that we can agree to disagree on the way to capture it, but I think there is really no new information here. So that's the first statement. So it's important to compare similar things. At least for us at the fund, we are aware and we receive this data. So that's the first thing. When it comes to gross international reserves, there again, we have our definition, a definition that we think is the right one. But Bank of Ghana also has a different understanding of what gross international reserve should account for. And the difference here is that Bank of Ghana counts the oil funds, right? The Heritage Fund and the Stabilization Fund as part of gross international reserve. And I think that point was clearly made at the beginning of the year by the governor of the Central Bank of Ghana that that's the difference and that's the position that they are taking. So to me, that's the clarification that I wanted to make.
Great.
For the debate about whether or not the government is messaging the data, I believe that Honorable Porting is a spokesperson and can take that up. But when it comes to the data that we've received and what we've worked with, in this debate, there's really nothing new that we did not know about. Thank you.
Okay. So just a little bit of a clarity. As far as the fiscal deficit is concerned, what the Fact Check Ghana did was to show from the budget statement that in 2018 and 2019, the government reported to Ghanaians 3.0% 2018, 4.5% 2019, while the data from the IMF statement 2018, which was 3.0, turned 7.0, and then 2019, which was 4.5, turned 7.5. Your explanation is that you were not supplied statements by the government of Ghana that contained these figures. Is that what you're saying?
That's not correct. That's actually not what I'm saying.
All right.
What I'm saying is the 4.5 that you see, for example, in 2019,
right,
does not include financial sector payments and energy sector payments.
Right.
Our number includes these two elements, and we know well, and I think that's not new, we know why the government of Ghana made the decision not to have these two elements in the fiscal deficit. I think these are not new.
So the essence of my question to you is, this is what you generated, not statements submitted to you by the state government of Ghana.
That's correct.
Okay.
This is what we generated. This is our understanding of the fiscal deficit. That's correct.
Okay. And when it comes to the gross international reserves, your explanation is the same method.
It's the same method.
Right.
It's the same method.
Right.
We have. I mean, let me first, state that we work with a lot of countries, and we do have some, how can I say, statistical standard. We may well disagree. For example, if you take the gross international reserve, and I think that's, a point that some people may agree to. I think the argument by Bank of Ghana is that if push comes to shove and they need additional buffers, they can actually, if you are in a situation of crisis, you can go to Parliament and request access to the oil funds. What we say is that perhaps it's more complicated than that, but we can agree to disagree and present the numbers that we think are more aligned to comparison with other countries, because that's our objective.
All right. My final question to you will be, it is your preference that when the government of Ghana is putting its financial statements together, it will include financial sector payments and energy sector payments? That's your preference?
We don't need to have a preference. I think that, and that's something that is unfortunate, I believe, in this debate. Reports comes, these tables are at the back of a report. When you go through these reports, all these discrepancies are discussed. And I believe that the budget statement also goes into I hope so, these discrepancies. Okay. So you cannot go to a report at the end of the report and compare apple and pears. You need to go through the report and understand what are the figures that have been presented.
As far as you are concerned, as far as your institution is concerned, nothing wrong is done by the non-inclusion of the financial sector payments and the energy sector payments. That's what you say.
That's not necessarily what I'm saying, but let me go back to that. For example, during the program that expired in April 2019,
right,
when the issue of the financial sector came up, because initially in the design of the program, this is something that was not anticipated, right? And the program aimed to achieve some fiscal targets. A decision was made that, look, the financial sector really needed to be taken care of. And if you really want a true picture of the fiscal effort that the government is making, we need to strip out financial sector cost.
Okay.
Because this is a necessary action so that you can generate growth, economic growth in the future. So we agreed on that, okay? On the financial sector costs, we agreed to put them aside and just measure the fiscal effort without financial sector cost.
All right.
Okay. So I think on the energy sector payment, that's a different matter. And I'll refer you to our report in December who goes into that.
All right.
Over.
Thank you very much. Albert Turner Mama, IMF country representative. Thank you so very much for your intervention.
Thank you for having me.
Great. Okay. So we decided that we thought that the most effective way to settle this debate and to make progress was to get to the IMF itself. And this has been the IMF explanation. Let me begin with John. Are you settled in your mind now? Any confusions or misunderstandings that you had earlier? And I saw you, I saw Adongo and the rest of you, banding this document about and charging the government for being dishonest and showing figures that do not reflect the correct status of the economy. Whilst, as you may say, it was deceiving Ghanaians back at home. When it comes to the gross international reserves, the budget statement here at home and presented to Parliament by the Finance Minister and repeated by all government functionaries was for 2018, 6,800, and for 2019, 8,100. Then you had, for what was reported by the IMF, for 2018, you had 5,300 5,317 as against 6,800. And then in 2019, 6,634 as against 8,100. So,
Samson, first of all, I'm sure everybody listened to the gentleman. He says that they disagree with government on the treatment. That's what he says.
Okay.
It's not me. So it's not like Jinapo Adongo says that there's contradiction. The IMF gentleman says that the way you are treating your gross reserves, we disagree. So let's put that in perspective. But even more importantly, there are two. There's the gross reserve and the net reserve. So let's assume that Bank of Ghana wants to treat the gross reserves, including petroleum flows. Why are the net reserves different? What accounts for the disparity between the net reserve quoted by the IMF and that quoted by government in the budget? Because the net reserve excludes all these the stabilization and those things. So why is it different? And I would wish my brother to deal with that. Two has to do with the deficit. Deficit is simply what you incurred in terms of expenditure as against your revenues. When you run a deficit, it means that there's a shortfall in terms of monies that you need to meet a certain obligation. If you don't raise enough revenue to deal with that deficit, it goes to hit your debt. So the question is, what is Ghana's deficit overall? And the IMF, they chose their words carefully. They say overall deficit, 7%. Is here, overall balance. So it's like I owe 10 million. 7 million to Kwaku, 3 million to you, Samson. And I say that minus Samson's debt is 7 million. So the question is, what is the overall deficit for this year? Because you must pay for that. That deficit will not vanish. And based on our national accounting system, you must recognize that. So what the IMF gentleman is saying is that our overall deficit is 7%. But less the financial sector and energy sector, it's 4.7 or 3.7, depending on how you want to look. That's the fact.
How would you look at it if you were told that you are comparing in a very wrong way provisional figures for the first 3 quarters of the year with actual full year data reported by the IMF?
I've seen people write that, and they don't even understand what they're talking about. They should take time and learn. I'm talking of 2018 figures. I chose my base year carefully. I'm not talking of 2019 figures. I know very well that when the minister was presenting the budget, 2019 had not ended. But 2018, in April 2019, they bring the figures. Then in the media review, he revises the figures. So when he comes in November or so, 2019, then I'm certain that 2018 figures are accurate. I'm not dealing with 2019 figures. If I wanted to deal with 2019 figures, I would have dealt with them. And this is what he says in the budget. I refer to page 3, paragraph 15. If the minister, in reporting to Parliament and Ghana, has stated the truth like the IMF states, then we can all be doing a proper analysis. Because the 4.5 or 4.7.
So let me come here.
Wait.
You're just mixing up the
On the same point, I ask you, what is the practice, the standard practice? Usually, the budget statement is presented in November each year. Is that not so?
Certainly. I think before 18th, that's what the law says.
So that will cover data up to the 3rd quarter of the year.
Yes.
Is that not so?
Yes.
So what's
and it will report on the outturns of 2018.
No, that will come in the media review.
Please explain.
Please, look.
Wait, let him explain. Yeah.
To start with.
Okay, let me just read this, if it's true or not. The minister tells you that in 2019, we ran 4.7 against 3.7 of 2018. So what are you talking about?
Yes, quickly.
What's this?
Well, to start with, let me make this point, that the Ministry of Finance, we operate an open door policy. If people have issues with figures, first come, let us explain to you what has happened. Then if at all you still decide to go out, at least you'll be guided by the perspectives we have shared with you. What the Fact Check Ghana did, I understand they are part of Media Foundation for West Africa. What they did was completely wrong, and I advise them to move away from this attitude of putting things that
okay, so you mean right. Their interpretation may have been wrong.
They are wrong on several points.
But they got the figures. It is their interpretation.
Their figures are wrong too.
Okay. Oh. Go ahead. Let's listen
now,
to you.
Now, let's look at their statement.
They didn't generate any figures. So you say their figures are wrong.
That's what I mean. Let me just... I go to their statement, and they said, below is a table comparing the data on the above-mentioned indicators, which are contained in page 24, paragraph 100 of the 2019 budget statement, and page 18.71 of the 2020 budget statement against the data from the IMF. Now, they then proceed, let's focus even on the 2019. So in 2019, I went to the page 18, paragraph 71, and this is how it reads. And John, pay attention so that you can help them. Mr. Speaker, provisional data available on the performance of the economy as at the end of September 2019. This is what they are quoting. Show that the targets for most of the macroeconomic indicators have been realized. A summary of this performance is as follows. Then we produce the figures that the fact-check people have produced in their statement. And then they compare the 3 quarters to a statement issued by the IMF in April 2020, covering the entire 2019. 2019. So what I'm saying to John and fact-check is that if they had come to the Minister of Finance and we had guided them that this is your error, they would definitely not have put this statement out. That's the first point. In the 2018, John, just pause and recollect this. When we bring budget statements, we report, because it's a for instance, if you take the 2018 budget statement, that would be submitted to Parliament November 2017. So you give the first 3 quarters of 2017. If you want to know the real outturn for the full 2017, you go to the 2018 media review.
What's this?
So you're just confusing the issues.
Continue. I'll deal with that. What's this?
You go to the
next balance of payment 2018 to 2019. This is the 2020 budget.
So what are you saying? What I'm telling you, if you pause and just listen, I'm saying that to get the outturn for, in fact, on this occasion they used 2018. You need to go to the 2019 media review, because at the time we're presenting the 2019 budget, we use the first 3 quarters. What they are doing is that they are taking the budget statements for 2018 and 2019. They did not even use a media review. They will not be putting these figures out. That is the error. And if, John, they are in contact with you, just mention to them that this is not how it happened. But when I listen to you yourself, I get a sense that you're also mixing up the 3rd quarter figures with the, and I've quoted the figures. Let's not debate about this.
And you would, Kweku, you more particularly will understand the NDC, because we have heard some people in government, particularly Gideon Bwako, suggest that the NDC has been caught before by the IMF in, dealing with wrong figures and then allegedly paying penalties. There's no proof that the NDC was made to pay any penalties.
So what is the gross figure for 2018?
And so the question now is that there's a fear by government.
Yes.
There's a certain percentage of GDP you are not supposed to cross. Yes. So you are deliberately dealing with the economic statement in a manner to avoid the implications of fiscal discipline.
If you did that, if you hit figures like that, as we did in 1999 and 2000, if you did that, you pay the penalty as we did in 2001. We paid the penalty for misreporting in 2009, 1919, and then 2000, under the previous Rawlings administration. So if you did that, that's punishment. But that is not what has happened. I've just explained And I'm quoting them. The figures are wrong. They just did the wrong thing. Somebody ought to advise them not to do that again.
We have barely 3 minutes to
yes.
go.
And then two, it is not just that. In addition to that, the IMF statement you refer to, all right? The statement itself states that overall balance, negative 7.5. Overall balance excluding financial and energy sector related costs. Then they quote negative 4.7. The 4.5 here is for the 3 quarters. If you look at end year, we reported in 4.8. The IMF is reporting 4.7. So there's no issue about you hiding figures. The way we did in 2000, that would warrant the kind of penalty.
What is the explanation? What's the explanation for the exclusion of the fiscal financial sector payment?
He explained
the what do you call it? The petroleum
he explained
energy sector payment.
He explained it. You see, you put these figures out to show a government's expenditure behavior against its revenue. Now, if you have such unanticipated expenditures, you want to isolate that and reflect that for the purposes of those who want to do business in your economy. This is not.
All right.
So it has been reported in the budget.
All right.
Oh, I'm saying that.
I'm sorry, but this all time will allow us.
Something.
Yes.
But let's answer one question.
Yes, ask that question and let's close.
What is your net reserve in terms of import cover for 2018?
Well, I have not the net.
You haven't checked. You said they are lying.
But they didn't.
You haven't checked.
They didn't talk about.
Oh, please. It's here. See.
Oh.
You haven't checked, and yet you said they are lying.
They didn't talk about net gross.
No, I just mentioned it. I'm saying that there's a discrepancy between the net in 2018.
But John,
and by the way, this is the 2020 budget.
Okay.
Everything about 2018 is reported here, and yet you say the 2020 budget does not report 2018.
Thank you, gentlemen. I'm sure that the matter has been dealt with succinctly and in a comprehensively succinct manner, particularly from the perspective of the World IMF. My guests have been Kuku Kwating, MP of Boase West and Deputy Minister of Finance, John Abdullahi Junapor, MP, Yape Kusogu, and Member Finance, Mines and Energy Committees of Parliament. Earlier, we spoke to Nana Kofi Kwache, who is a research fellow with the New York's University School of Global Public Health. He's also with the NDC's COVID-19 team. Dr. John Amwesi of the KCCR Kumasi, and also Prosper Bunny, Chairman NDC's Technical COVID-19 team. And of course, Gideon Bwako. I'm Samson Ladi Anyanini. Have a good afternoon. Please take care.